Absheni. Good morning. Goeiemorgen. We are starting the business of the day, which is a public hearing.
Lochani mphakathi we Witbank ayitluwa sizokuthoma ke nje ngomsebenzi wethu wanamhlanje ekukulalelwa kwamazizo womphakathi.
My name is Anagela.
Ibizo lami ngingu-Anagela.
I'm the acting chairperson of the Portfolio Committee on Health.
Ngibambele usihlalo wekomiti le esisebenza kiyo.
I'm going to request a member of a community, a volunteer, to open this session with a prayer.
Ngizokbawa ke ilunga linye lomphakathi elingakhona ukuthi lisivulele ngomthandazo.
Any pastor or reverend?
Ingabe kukhona umfundisi ngendlina?
Anithandaza apha eMpumalanga na? Ningasabi bomake. Thank you very much. Can you all rise?
Ngizokbawa ukuthi sisikime sonke.
Obaba bathula iminqwazi.
Singavala amehlo, we can all close our eyes. Our Heavenly Father, may your name be honored. May your kingdom come soon. May your will be done on earth, just as it is in heaven. Give us our food for today and forgive us our sins as we forgive those who sin against us. Don't allow us to temptations, but deliver us from the evil one. And even if we shall walk through the veil of death, we shall not be afraid. Forever and ever we shall dwell in the house of the Lord. Amen.
Thank you very much. Bengisacela ukuthi ningahlali phansi nisukume. We are going to sing the national anthem. Thank you very much. If I can check, there's anyone from the MEC's office, from legislature?
Ngingathanda ukuhlola ukuthi ingabe kukhona ovela emnyangweni akasomkhandlu esiphethe emthethweni salapha eMpumalanga.
Akekho. Any councillor from the district?
Ingabe ukhona ukansela ovela esingini sangapha?
Okay. Okay. Okay, I'm told that the speaker, she's coming.
Bayangitshela ke la ukuthi usomlomo uzokufika naye uyeza.
Dumelang, good morning. Welcome to this public hearing, which are the public hearing by the National Assembly of
Siyanamukela ke
Parliament
siyanamukela ke kilokhu kulalelwa komphakathi okwenziwa yiParliamente yenarha yalapha eSouth Africa.
and thank you for making effort to come.
Siyathokoza ke ukuthi nizithwenye nifike namhlanje.
I'm going to allow members to introduce themselves.
Ngizokuvumela ke amalunga ukuthi azazise.
I'm going to start on my left hand.
Ngizokthoma ngesinceleni sami ke.
Dumelang, goeiemorgen, good morning. My name is Philip van Staden. I'm a member of the National Assembly and a member of the Portfolio Committee. And Honourable Chair, if you can allow me, I just want to congratulate our national team last night with a great winning against England.
Sanibona. Igama lami uStumo wakwaDlamini,
My name is Tumo Dlamini,
ilungu leParliament lase South Africa,
a member of the National Parliament of South Africa
nale committee yezempilo.
and a member of the Health Committee.
Ngiyabonga.
Thank you very much.
Good morning.
Lotshani.
Goeiemorgen, Dumelang. You are all welcome here this morning. My name is Janine Notnagel and I'm from the
Namukelekile ke
National Assembly
namhlanje njengoba ilunga lizethula.
and I'm a member of this committee. Thank you.
Liyatsho ke ukuthi ilunga lekomiti le.
Dumelang,
Lotshani,
igama lang Madeleine Hicklin,
my name is Madeleine Hitler.
and I am so thrilled to see everybody here today. I am a member of the Health Committee portfolio,
Ngithabe khulu ke ukubona bonke abantu abakhona namhlanje lapha ngililunga lekomiti yezamaphilo.
and I just want to remind everybody that October is Breast Cancer Month, and let us all remember to honor those victims of gender-based violence.
Ngithanda
Thank you.
ukukhumbuza wonke umuntu ukuthi inyanga kaSewula inyanga yekankere yebele begodwa uthanda ukukhumbuza bonke abantu mayelana nomguruguru okuhlukumezana ngezobulili.
Sanibonani. Okay, my name is
Hello.
Nhlanhla Xaba. I'm the member of the National Assembly, the member of Portfolio Committee of Health, hailing from the African National Congress. Thank you.
Ibizo lami ke uNhlanhla Xaba ngililunga lekomiti le ngivela ehlanganweni yeANC.
Good morning, Dumela.
Lotshani,
My name is Dr. Xiaomei Harvard,
ilunga ke liyazethula ukuthi lingubani.
a member of Parliament and also member of Portfolio Committee Health.
Ilunga lili ilunga leParliament yeSouth Africa kanye nekomiti le yezamaphilo.
Wish I can learn from all of you this morning. Thank you.
Ngiyakuthabela
Good goeiemorgen, Abusheni. Dr. Susan Tembekwayo, Member of Parliament and Member of Committee on Health. Thank you.
ngingu Dr. Susan Mthemekwayo ilunga lekomiti le mthetho seParliament.
Dumelang, goeiemorgen, good morning.
Lotshani,
My name is Michelle Clark. I'm a member of Parliament,
ibizo lami ngingu Michelle Clark ngililunga leParliament,
also a member of the Health Committee And I'm sure we're
Begodu-
going to have some great discussions here today after that win. Everybody should be invigorated here today. Thank you.
Begodu ke ngililunga lekomiti yezamaphilo begodu ngithemba ukuthi sonke sithabile ngemva kokuthumba kwesicema seBhokobhoko izolo.
Indeed, we are happy as South Africans.
Kwamambala sithabile njengamaSouth Africa.
Di Boke, basenze sashine izolo.
The Bokobhoko squad yesterday made us proud.
We want to take this opportunity to congratulate them,
Sithanda ukuthatha ithubeli sibathokozise.
and we know that they will bring the cup
Begodu
to South Africa.
Siyazi besiyathemba ukuthi bazoyiletha ibhegere ekhaya.
We wish them all the best.
Sibafisela konke okuhle.
We know our ancestors are very strong.
Siyazi ukuthi ke abezimi bethu banamandla kakhulu.
Let me continue with the introduction. I'm going to introduce the staff.
Ngibawa ukuragela phambili ke nokwazisa abantu esikhamba nabo nalabo abasebenza nathi.
I'm going to start with our portfolio secretary,
Ngizokuthoma ke ngazise unobhala wekomiti
Ms.
yethu
Majalamba.
unkosikazi Majalamba.
Sis V? Oh, she's still outside.
Kubonakala ngasuthi usesengaphandle.
Ms. Mtia,
Nangu uMs Tia,
Ms. Ngomane,
umawa wangomane,
Mr. Rahim, our
uMnumzane
researcher unit,
uRahim, umkhubhululi wethu,
Mr. Nwabe
nomhlonitshwa uNcwane,
is also our researcher.
naye umkhubhululi wethu.
Ms. Magubane, she's outside busy with the registration.
Kunomawa wamagubane ongaphandle ke nguye otlolisa abantu ngapha eminyango.
Ms. Daveni,
Nomawa kwaNtabeni
also outside.
naye ungaphandle.
We also have the office of the minister.
Begodu ke sikhambisana nemphathiswa ezivela ngeofisini kaNgqongqotjhe.
Who is our parliamentary liaison officer,
Umthindanisi ke weParliament nekomiti
Mr. Joe Khatla.
umnumzane uJoe Khatla.
We also have members of the National Department of Health, led by Chief Director
Sinamalu-
Dr. Lin Weng.
Sinamalunga ke avela eminyangweni wezamaphilo.
We don't have anyone from the MEC's office or the mayor, but
Akekho
we are
ke-
still waiting for the speaker to arrive.
Akekho ke ovela ngeofisini kaSomkhandlu walapha eMpumalanga wezamaphilo kodwa ke sisalindele usomlomo njengoba kwazisiwe ngaphambilini.
Let me also welcome all members of various organizations
Ngithanda ukwamukela wonke kamalunga wenhlangano ngokwahlukahlukana kwazo
and also of the public that are here today.
kanye namalunga womphakathi alapha namhlanje.
And also we have people who are doing interpretation for us.
Sinalabo ke abasihumutshelako nofana abasitologelako.
They are led by Peter Migwe. I don't know
Badoswa
whether he's
phambili
here.
ngu
Okay. We also have communication officers,
sinaba imphathiswa ke ezisebenza ngezokuthintana
protection services,
labo abasebenza ngezevikeleko.
we also have advocate Lufuno Makoshi,
Sikhambisana ke no advocate uLufuno Makhoche,
Lorato Mahura,
kanye noLorato Mabura ule emuva.
Sam Chengwang, Zengang,
No sense ngane naye ule emuva.
Zikhona
No dadwethu lapha uzikhona.
those are the people that are supporting us.
Labo babantu ke bakamba basiza basisekela ko.
But we also have people who are doing sound and vision for us. The
Sinalabo
ICT.
ke abathwebula intombe ke nabo nemgadangiso.
Let me also acknowledge the MMC,
Ngithanda ke ukutsho ukuthi sino MMC hlangana nathi
ward councillor,
kanye ne ward councillor
Nombuso Mukwena.
udade unombuso Mgwena.
Can you please stand, Sikbon? Okay. And also ward councillor,
Begodu ke sine councillor, ward councillor
Anna Mtweni.
nango ke uyaphakama.
Councillor Vincent Mukwela, or Mukwala,
Sino councillor ko Vincent Mukwala.
from district. We also have Councillor Nelly,
Sino councillor Uneli,
Councillor Nelly Masebuga.
Uneli Masombuga.
Those are the councillors that are here with us to listen.
Lawo ke ma councillor ahlangana nathi ukuzo akhambele lokho kulalelwa komphakathi.
You are all welcomed.
Namukelekile nonke.
Now I'm going to deal with the purpose of the public hearings.
Njenga nje ngizokhuluma ke ngenhloso zalokho kulalelwa komphakathi.
The Tobacco Products and Electronic Delivery System Control Bill.
Lokhu ke kumayelana nomthetho mlingwa olawula imikhiqizo yegwayi nalezi insetshenziswa zegezi ekubhenywa ngazo igwayi.
B33 of 2022
Ibhili ke enonjorwe ngendlela umhlonitshwa atsho ngakhona.
was introduced in Parliament by the Minister of Health
Lo
on,
mthetho mlingwa ke wethulwa ngungqongqotshe wezamaphilo eParlamente
on the 31st May 2023.
ngomhla ka 31 kuMeyi ngomnyaka 2023.
Section 59.1
Isigaba ke asikhuluma ngaso umhlonitshwa
of the Constitutions requires the National Assembly
sifuna bona ke iParlamente yenaga
to of the Assembly and its committees
iParlamente yenaga kanye namakomiti wayo
facilitate a public participation in the legislative and other processes.
ukuthi ke ibambe ukulalelwa komphakathi nokulandelwa kwezinye ke indlela zokuphasiswa komthetho.
The Portfolio Committee on Health therefore
Ngalokho ke le komiti yezamaphilo
seeks to increase access and improve the quality of public participation
ifuna ke ukunabisa ukulalelwa kwamazizo womphakathi nokuhlanganyela komphakathi
through informing, educating, consulting and involving the public
kanye ke ngokwazisa nangokufaka hlangana nofana ukubandakanya komphakathi okufaka hlangana lokhu
in the processing of the Tobacco Product and Electronic Delivery System Control Bill.
eku beregweni ke kwalomthetho omlingwa olawula ukusetshenziswa kwegwayi kanye nezinye insetshenziswa ezisetshenziselwa ukubhema.
This visit to the Mpumalanga province represent the third leg of the public hearing on this bill.
Lokhu ke ukuvakatsha esikwenze namhlanje lapha esifundeni seMpumalanga kujamele umlenze wesithathu kokulalelwa kwalokhu kokulalelwa komphakathi lokhu.
The Portfolio Committee will be visiting all 9 provinces.
Le committee ke izobe ivakatshela ama province alithoba wenaga yeSouth Africa.
The bill seeks to repeal the Tobacco Product Control Act number 83 of 1993.
Lo mthetho mlingwa ke ekuzokhulunywa ngawo namhlanje unqophe ukuphelisa umthetho omdala umhlonitshwa awubizako
And its 3 amendments, 99, 2007, and 2008.
kanye ke neminye imithetho eyaba machukuluko yeminyaka le umhlonitshwa ayibalako.
The current bill will close the loopholes
Lo mthetho mlingwa ke wanje ufuna ukuvala lapha bekubonakala ngasuthi kukhamba kuba nengikhala khona
and address certain aspects not covered by the Primary Act.
bese ke uqalelela ezinye izinto ekade zingaqalelelwa umthetho wangaphambilini.
This bill aims to, amongst other things,
Lo mthetho mlingwa ke unqophe hlangana nokhunye
to bring tobacco legislation
ukuletha imithetho elawula igwayi
in line with the current developments internationally
ngokukhambisana ke nalokho okwenzakalako enchabathabeni
by regulating smoking,
ngokuthi ke ukhandele ukubhenywa endaweni ezithize
the packaging sale,
kanye nendlela igwayi elifakwa ngakhona empakaneni
and advertising of tobacco product and electronic delivery systems.
kanye ke nangendlela igwayi elikhangiswa ngakhona nezinye ke insetshenziswa ezisetshenziselwa igwayi.
There will be a prohibition of smoking in certain areas.
Sorry.
There will be a prohibition of smoking in certain areas,
Kuzokuba nokukhandelwa kokubhema ke kezinye indawo,
such as enclosed public places
indawo ezifana nendawo ezivalekileko zomphakathi,
and workplace,
indawo zokusebenzela,
in any motor vehicle
ngaphakathi kwenthuthi ke nanyana ngisiphi isithuthi nofana ikoloyi
or a private enclosed space
nofana indawo yangeqadi evalekileko.
when a non-smoker
Lokha kunomuntu ongabhemiko
or a child is present.
nofana kunomntwana.
In a private dwelling,
Endaweni yangeqadi ke
premises
endaweni zangeqadi
of a multi-unit residence,
endaweni zangeqadi ezihlala abantu abahlukahlukeneko
if smoking interferes
nangabe ukubhema ke kuchayisana
unreasonable with others.
kuchayisana nabanye nofana kunabanye ngapho abangakhonani negwayi.
The bill prohibits all forms of advertising
Umthetho mlingwa ke ukhandela nanyana ngiyiphi indlela yokukhangisa
or promotion of tobacco
nofana ukuthuthukiswa kwegwayi ofana ukwaziswa kwegwayi
or electronic delivery systems
nofana lezi insetshenziswa ke ezinye ke njengemchini le ethengisa igwayi.
The minister will prescribe the packaging
Ungqongqotjhe ke uza kuveza indlela yokuthi igwayi kufanele lipakwe njani
and labeling of tobacco products
nokuthi ke kube namiphi imitlolo phezulu kwepakana yegwayi
including a health warning.
okufaka hlangana ke ukuyelelisa ngezamaphilo.
The bill brings among restrictions of sales of tobacco products
Umthetho mlingwa ke uza nokhunye ukukhandela kokuthengiswa kwemikhicizo yegwayi
not allowed to sell to children
njengokuthi lingavunyelwa ukuthi lithengiselwe abantwana
in health establishments
endaweni zezamaphilo
and no distribution through the postal services,
begodu ke lingasatshalaliswa ngokusetshenziswa insetshenziswa zeposo
courier services,
lezi zamakorea
or the internet.
nofana i-internet.
The minister will appoint a monitoring committee
Ungqongqotjhe ke uza kukhomba ikomiti eza kubeka ilihlo
that will monitor the implementation of tobacco control programs
eza kubeka ilihlo ke ukukhanjiswa nofana ukusetshenziswa kwalamahlelo alawula ukusetshenziswa kwegwayi
laws
ukulahleka
and enforcement.
imithetho nokugandelelwa kwayo.
In conclusion,
Isiphetho ke
the bill seeks to provide a legal framework
umthetho mlingwa lo ke ufuna ukwenza umleyo okhambisana nomthetho
for vulnerable groups
mayelungana ke nalabo ababuthakathaka
such as children,
abafana nabantwana
pregnant women,
abomma abasebantwini
non-smokers,
labo abangabhemiko
including those who do not smoke e-cigarettes,
ukufaka hlanga labo ke abangabhemi lamagwayi afana ke lapho kusetshenziswa ama vapor nofana lamanye adoswa ngama pipe
and employees.
kanye nabasebenzi.
Now the process to be followed,
Ikambiso ezokulandelwa
I'm going to give you an opportunity
ngizoninikela ithuba
to make your own submission regarding the bill.
ukuthi nenze izethulo zenu mayelana nalomthethomlingwa.
Each representative or a speaker
Nangabe kukhona ke ihlangano ijameleko nofana loyo uzokusikima akhulume
will be given 5 minutes to speak.
uzokunikelwa imizuzu emihlanu ukuthi akhulume.
You will introduce yourself first
Uzozethula ke wena kokuthoma uzazise
and state which organization are you representing
bese uyatsho ukuthi uvela kiyiphi ihlangano
or whether you are a member of a community.
nofana ulilunga lomphakathi.
I think we also have submission forms on the table.
Kukhona ke namafomu ongawenza ngawo izethulo zakho lapha
In that
ematafuleni
table.
lapha ematafuleni.
When I was introducing the staff, Ms. Majalamba was not here.
Lokha nangazisa abasebenzi bethu
I'm going to request you to stand our health secretary.
manje ngizombawa ke ukuthi asikime nimbone.
So you'll get forms from that table from secretary.
Nizokuthola ke lama forum engikhuluma ngawo etafuleni lapha hlezi khona umma lo.
But also let me acknowledge the presence of the speaker.
Ngithanda ke ukutsho ukuthi usomlomo selafikile.
Councillor Mduduzi Mswati Kankosi.
Ukhansela Mduduzi Mswati kaNkosi.
Speaker, you were supposed to welcome us, but I've done that on your behalf.
Somlomo
you'll make,
bekufanele usamukele
closing
manje
remarks.
sele ngikwenzile lokho.
But we are honored, we feel honored to have you in this
Sizizwa sihloniphekile ukuthi ubehlangana nathi namhlanje.
public hearing.
Kilokhu
Now
kulalela
I'm going to
komphakathi.
invite hands,
Njeke ngizokubawa ukuthi niphakamise
those who
izandla
want to contribute, to make input.
labo abafuna ukwenza izethulo.
Ndizoba ne one round.
Ngizoba
So
nomzombe
walala
munye.
wasala. I am joking.
Ngiyadlala nje kuphela, ngiyazidlalela nje.
I'm still on the mood of Boki.
Isaphethwe moya wamabhokobhoko.
And I'm going to start this side.
Ngizokuthoma ngehlangothini langesidla.
The lady in front with the t-shirts, flourish, you will be number 1.
Uyabakhomba ke umhlonitshwa labo abazokukhuluma.
The lady with black t-shirt, number 2. The guy with the cap, number 3.
Umnakwethu kombethe ikepisi uzokubanga wesithathu.
The guy with the black t-shirt, number 4.
Uyabakhomba ke njalo umhlonitshwa abazokuphiwa ithuba lokwenza ithulo.
Councillor Vincent, number 5. Councillor Vincent. Councillor Vincent, I've got also another Honorable Vincent Klaba. The guy with the t-shirt. Councillor,
Masombuka.
I'm going at the back. There's no hand there in the middle, ne? Nithule phayana. Oh, ndiyaqhida. Bendizanibiza ngamagama kodwa ndiyaqhida. The lady at the back with the black and t-shirts and blue. the lady at the back with the glasses, yes. The guy at the back with the, yes. And then there's, it's full now. Okay. You can start number one.
Ungathoma ke
Remember
sesi-
that I've got somebody who's a timekeeper. Ne? When
Nikhumbule ke ukuthi
starting to
nginabantu
hold my mark, you must know that
abazongithathela
the
isikhathi.
time is up. When I'm doing this,
Nangithoma ngibetha imayiki ke kufanele wazi ukuthi isikhathi sakho sesiphelile.
we are starting. Timekeeper.
Good day, everyone. Good day to the members of parliament and chairperson.
Ke dumedishe bohle le maloko a parlamente mmogo le modulasetulo.
Different NPOs and NGOs and members of the community.
Le maloko a di NGO tše fapanego mmogo le maloko a setšhaba.
My name is Neodi Kobe, member of the South African Tobacco Free Youth Forum and provincial secretary in Gauteng.
Leina la ka ke Neo Di Kobe ke leloko la South African Youth
Youth Desk.
Youth Desk Tobacco Free Forum.
As I am here, I just came here to emphasize that the bill does not say burn, but the bill says that regulate.
Jwale ge ke le mo ke tlile go tšweletša ntlha ya gore molaokakanywa o ga o re go swanetše go fedišwe eupša o re go swanetše go laolwe.
It says that it should, to regulate is to control the selling of tobacco.
E hlalosa gore lentšu le regulate ra gore go laolwa thekišo ya metšoko.
And as I'm here, I've written why is the new tobacco control law is required in South Africa.
Jwale ge ke mo go hlalosa gore ka lebaka la eng molao o moswa o le go mabapi le metšoko o le bohlokwa le gona o hlokega mo Afrika Borwa.
Number one, to save the environment.
Ka mathomo ke go ka boloka tikologo.
By so saying, we have right to an environment which is not harmful to our health.
Ka go rialo ke ra gore re na le tokelo ya go ba le tikologo yeo e leng gore ga e kotsi mo maphelong a rena.
And prevention of air pollution and ecological degradation.
Le go ka kgonthiša gore le ratadima mmogo le tikologo ga di gobale.
Number two, to protect children and the youth from initiating tobacco and e-cigarettes.
Le go ka thibela bana gore ba tsene mo go gogeng metšoko mmogo le metšoko e ya mohlagase di e-cigarette.
By so saying, to protect our children from having easily access to these dangerous products and also teaching them more about the harms these things can cause in their lives.
Ka go rialo ke ra gore go thibela bana ba rena gore ba thome mekgwa e ya go goga yeo e leng gore e ka ba le kotsi mo maphelong a bona.
Number three, to protect human rights.
Ntlha ya boraro ke go ka šireletša ditokelo tša botho.
By so saying, everyone has the right to life.
Ka go rialo ke ra gore batho ka moka ba na le tokelo ya bophelo.
Equality and access to information.
Tekatekano mmogo le phihlelelo ya tshedimošo.
Right to environment which is healthy and right to dignity.
Tokelo ya tikologo yeo e leng gore ke ya bophelo bo bo botse mmogo le seriti.
By so saying, I am here as a young person standing with the bill.
Gomme ka go rialo ke mo bjalo ka moswa le gona ke thekga molaokakanywa o.
Sanmanan,
Greetings.
Kamala Monoktula Mpilwa, Suge Gauteng.
My name is Noktula Mbilwa from Gauteng.
Ngibuya ku-organization ethi South African Tobacco Youth Forum.
I come from organization that is South African Youth Forum.
Okokuqala ngizothi ngiyamelana nebill.
Firstly, I do not support the bill.
Tobacco is dangerous. It contains nicotine and tar, which is heavy for our health.
Ugwayi
Why are you-
uyingozi ngenxa yokuthi uqukethe inicotine kanye netar enomthelelo ongemuhle emzimbeni womuntu.
Tobacco is especially bringing us too many diseases like cancer. It can make you to have short breath.
Ugwayi ubanga izifo eziningi njengomdlavuza futhi ungakwenza ukuba ungakwazi ukuphefumula kahle.
Tobacco can cause a loss of color of your teeth and also make your fingerprints be yellow.
Kanti futhi ungakwenza ukuthi amazinyo akho alahlekelwe umbala kanye futhi nasezandleni zakho iminwe ingase ishe.
Therefore, I still say I stand with the bill.
Ngakho ngithi ngiyawusekela umthetho osivivinya.
Sanibona.
Greetings.
Sanibona. Sithanda ukuthokoza kakhulu.
Thank you so much.
We'd like to say thank you to the Portfolio Committee of Health.
Sithanda ukubonga portfolio committee lena elapha ezempilo.
For ukuthi isinakelele nasenza amabhili njengala kuyakhombisa ukuthi they are considerate to the members of the public.
Ngokwenza kwabo imithetho sivivinyo efana nalena isho ukuthi bayawukhathalela umphakathi.
Sithanda ukuthokoza nawo wonke umphakathi ofikile ngelanga namhlanje zokufaka imbono yawo.
And we also want to thank the community who are here now today to share with their opinions.
Lami igama ngitshepo Masilela.
My name is Tsepo Masilela.
I'm from Expose SA.
Ngivela Expose SA.
We are holding government departments accountable.
Okuyithina esenza ukuthi iminyango kahulumeni iphendule.
Ibhili le siyayithokoza kakhulu. Ngaphambi ukuthi ngaragela phambili sithanda ukuthi siyayamukela thina.
Before I speak what I would like to say, but first of all I want to say we support the bill.
Umbono wami bekukutheni, we need to create or to invent or to design certain innovative and sustainable programs that will take them to the schools where our young generations are at to educate them about this tobacco.
Owami umbono ukuthi kufanele siqhamuke nezinhlelo ezintsha ezizosiza sizithathe siziyise esikolweni lapho kufunda izingane khona ukuze zifundiswe ngazo.
Because of abantwana laba abancane, they are the future of this country.
Because these children bayikusasa lezwe lethu.
As we stand here, all of us, there are no scholars or learners who are in here, and we are trying to design a law that will be able to protect them from tobacco and everything. They were supposed to be here so that they can learn about such matters.
Njengoba sikhuluma nje lapha azikho izingane nabafundi okuyibona kodwa esikhuluma ngabo kulomthetho sivivinyo ngakho bekuyoba kuhle ukuthi kuba bakhona lapha ukuze nabo bafunde.
I would like to bring a submission to our advocate who's here.
Ngithanda ukuletha izethulo zami ku advocate okhona lapha.
Hence we spoke about women who are smoking while they are pregnant. Who are protecting those unborn kids?
Njengoba sikhuluma ngomama akutholakala ukuthi bayabhema bebe bekhulelwe ubani ovikela lezo zingane ezisuke zisesesiswini.
Bengathanda ukuthi whenever we amend this constitution, let's find a law or a certain policy that will protect these unborn kids because of no one is protecting them.
Uma sibhala lomthetho noma siwuchibiyela bengingathanda ukuthi makube khona nomthetho ozovikela lezo zingane ezisuke zisesesiswini ngoba akekho sivikelayo.
Ngiyathokoza lo bill le siyayiphasisa.
Thank you. I support the bill.
Greetings to all. Good morning to everyone.
Ngiyanibulisa nonke.
I would like to say I appreciate the bill. I welcome the bill and all of you.
Ngithanda ukusho ke ukuthi ngiyawamukela lo mthetho sivivinywa futhi ke ngiyanamukela nonke.
I won't be long standing here,
Angizokhuluma isikhathi eside.
but my submission here is we have to have a self-realization while we are still alive.
Kodwa ke engithanda ukusho ukuthi ke kumele sizizwisise sisaphila.
I don't have, like, today we can't stop everyone in the world, human beings, to stop smoking.
Manje ke soze sikwazi ukuvimba bonke abantu la emhlabeni ukuthi bangasabhemi.
But what we do, yes, I agree with all my colleagues before me that we have to aid them.
Kodwa ke esikwenza ukuthi ngivumela nabo bonke laba ebese bekhulumile ukuthi kumele sifundise abantu.
But my problem, since well I've mentioned that my submission to all of you, that those people who are smoking are here on the ground, people from the community.
Kodwa ke engifuna ukusho ke ukuthi ke labantu ababhemayo ngabantu abahlala emphakathini.
And most of them that were smoking, they are smoking out of stress.
Futhi ke ubuningi bantu labo ababhemayo benza incindezelo yomqondo abanayo.
Family conflicts, abuse, rape, it's fall under one umbrella-based violence.
Okanye izimpi ezikhona emndenini, ukuhlukunyezwa kanye nokudlwengulwa, konke lezo zinto zibanga istress.
My saying to all of you, those stress is caused by unemployment.
Manje engikushoyo kini ukuthi ke leyo ncindezelo ibanga ukungabi khona kumsebenzi.
So since well you are amending this bill, what I'm to say to all of you,
Manje njengoba ke nenza ushintsho kulo mthetho okhona engikushoyo kini yilokho.
I won't mention the way they've mentioned. I will say to you, create jobs, work with people around, create activities because of people are smoking. While people are smoking, you out there, you are benefiting. But in return,
engizokukini ukuthi ke yenze isebenzi ngoba labantu babhema ngoba banengcindezelo. Futhi ke uma bema kanjalo abantu ababenefitayo yini?
since well, but I won't stand pipeline of making the income because at the time this brand, this company is creating economy. I agree with that. Yes, I agree with the people who educate, bring problems into our schools. But I'm saying to you, at the same time, create jobs. Listen to us from the ground. We have to pay as well. People are, because of people are smoking and eating the cigarettes with their own money.
I'm sure you'll get waiting ngempela ama company lawa akhulisa umnotho. Kodwa ke kubalekile ukuthi ke nidale isebenzi ngoba abantu banencindezelo bane stress. Futhi ke ngicela ukuthi uma niyenza njalo sebenzisane nomphakathi.
I want, but lastly, all I'm trying to say to all of you, I'm not harsh. It's just the situation facing on the ground.
Ngizoshini ke ukuthi ke nanoma ke ngizama konke ngikhulumisa naye kahle isimo esibhekene naso laphansi.
the same time, because of the people are complaining about the lack of quality currently, it's damaging their health, it's causing their health. How about you, sector, that you go back and teach quality, come back, as I said, on creatives, go back to the farming of tobacco that creates, or farming the quality of tobacco, so that you can choose a better quality of cigarette. That is part of creating jobs. But if you coming back to our communities and make us learn and work with us, so that we can learn about farming of the tobacco. Thank you.
Before you leave, hello. Before you leave the podium, please introduce yourself.
Oh, sorry. My name is Siviso Pemuntuli.
Thank you.
Yes, thank you.
Okwamanje into enzakalayo ukuthi umphakathi uyakha quality yogwayi. Ke manje into sicela ke ukuthi niyenze nina ukuthi ni sebenzisane nabo nibanikeze futhi imfundo. Nakhona niphinde futhi ke ningenelele kulama company lawa aveza itobacco ngokuthi ke nisebenzisane nabo niqinisekise ukuthi ke baveza itobacco ene quality, ngoba uma ine quality ephansi igcina se ilimaza labantu laba ababhemayo. Saphinda futhi ke ngithi uma nenza njalo nibhekisisa ukuthi ke lama farmers aveza tobacco ene quality, lokho kuzobe futhi kusiza ekudaleni imisebenzi. Ngiyabonga.
Good morning, everyone.
Ngithanda ukulotshisa wonke umuntu okhona ngendlini.
My name is Vincent Mokwala.
Ibizo lami nginguVincent Makwala.
I am a councillor at Nkangala District Municipality.
Ngilikhansela ke umasipalata weNkangala District nofana siyingini seNkangala.
I'm a member of the Democratic Alliance.
Ngililunga le-Democratic Alliance.
Much as we appreciate the bill,
njengoba ke sikuthokozela ukwethulwa kwalomthetho omlingwa.
however, my concern is its flaws.
Kodwana ke engikhathazeke ngakho zinkhala ezikhamba zibonakala kiwo.
And to me, the biggest challenge
Kimi ke isitshijilo esikhulu
is the fact that I don't see much
liphuzu lokuthi angikuboni okunengi
in terms of control of illicit cigarettes,
okumayelana ke nokulawula igwayi elingekho emthethweni lofana igwayi lomgunyathi,
in terms of drugs,
ukulawulwa kwendakamizwa,
because we must also acknowledge
begodu ke kufanele samukele
that this industry
ukuthi leli ibubulo legwayi
create jobs.
lenza imisebenzi nofana lakha imisebenzi.
For example, here in Mpumalanga,
Ukwenza isibonelo lapha eMpumalanga
it contributes almost 18 million to the economy.
lifaka ke pheze ingidi ezi 18 million emnothweni walapha eMpumalanga.
Now I am submitting that
Ngethula ke lapha
let more stronger rules be implemented in terms of controlling illicit cigarettes.
akuqiniswe ke imithetho nofana kwenziwe imithetho eqinileko ezokulawula igwayi lomgunyathi.
Because that's where our biggest problem is, because illicit cigarettes don't contribute anything to tax to the economy of our country.
Ngombana ke kulapho umraro omkhulu ukhona. Ngombana leli gwayi lomgunyathi alisiphi litho alifaki lutho emnothweni wethu.
If you can see now, what destroys and devastates our youth is the Nyaupe drug.
Na ungaqala ke nje okuhlangahlanganisa abantu abatsha bethu ilesi sidakamizwa esibizwa ngenyawupe.
How much are those people who are selling these drugs contributing to the economy in terms of tax?
Laba abantu abathengisa lesi sidakamizwa bangenisa ini emnothweni mayelana nomthelo.
And to be honest,
ukhuluma iqiniso,
the smokers have responded to the rules.
Labo ke ababhemako bayayithobela le mithetho.
As you can see, we are in this hall.
Njengoba singaphakathi kwale holo,
no one is smoking.
Akekho namunye obhemako.
Where we are in public spaces,
nasisendaweni zemphakathi,
smokers will always move aside and have where they are smoking.
Abantu ababhemako kanengi ke bavame ukuthi bachidele ngeqadi baye lapha kuvunyelwe khona ukuthi babheme.
Even in restaurants, you have smoking zones and non-smoking zones.
Begodu ke nendaweni zokudla kunendawo ke ezibekelwe ngeqadi ukuthi ababhemako babhemele kizo.
So that's why I'm saying that the industry is doing its best
Kungakho ke ngitsho ukuthi leli bubulo lenza okusemandleni
to comply.
ukuthi lithobele imithetho.
Therefore, let there be more stronger steps taken against those who are breaking the law.
Yoke sithi ke akuthathwa amagadango aqinileko mayelana nalabo abaphula imithetho.
I so submit.
Submit lezo.
Thank you very much. Greetings, Chairperson,
Ngiyanilotshisa sihlalo ngaphambili.
with your colleagues, Dr. Susan Tembagwayo, our commissar in the Economic Freedom Fighters.
Nabasebenzisani bakho ke uDr. Thenjekwayo.
My name is Tebogo Mahlangu from EFF Nkangala region.
Ibizo lami ngingTebogo Mahlangu ngibuya ehlanganweni yeEFF eregionini yeKangala.
Let me not forget to greet the incoming president of Republic of South Africa, Sir Julius Malema.
Ngingalibalike ukulotshisa umengameli wangomuso weSouth Africa.
In terms of quoting from the Constitution on Equality Clause, section 9, subsection 3. Oh, these people, they were making noise. Quoting from the Constitution, Equality Clause, section 9, subsection 3.
Umhlonitshwa ke lapha uthi utsubhula kumthetho mlingwa ingajana lezo azibizileko.
The bill seeks to discriminate against our people and not only smokers in general.
Umthetho mlingwa ke lo ufuna ukubandlulula abantu bethu begodwa ingasababhemako kuphela.
But also our people who believe in traditional cultural practices.
Begodwa ubandlulula nabantu ke abakholelwa ekwenzeni izinto zamasiko.
We use the tobacco products such as snuff to perform rituals traditional healers prescribe.
Sisebenzisa ke lo mkhiqizo wegwayi awubizako ukwenza ezinye izinto zesintu nofana zamasiko.
The tobacco leaf for medical purposes and healing.
Sikusebenzisela ke mayelana nokwelapha.
Section 9 says that the state may not discriminate unfairly against anyone but in this regard.
Isigaba sethoba ke siveza ukuthi ke akunamuntu ekumele abandlululwe mayelana nalokho.
Our people will be discriminated against because they're using tobacco products and they are part of communities that relies on tobacco to do their practical cultural practices.
Abantu bethu ke bazokubandlululwa ngombana basebenzisa lemikhiqizo yegwayi begodwa bayisebenzisela.
This government undermines fundamental rights and hate the traditional leaders.
Lo khulumende ke uqalela phasi amalungelo abantu asisekelo begodwa uhloye nabantu abenza izinto zamasiko.
When we go on political economy issues,
nasiya ke endabeni zezepolitiki nalezo ezifaka umnotho.
We reject this bill because of there are many black emerging tobacco farmers in Mpumalanga who employ thousands of people.
Siyawuraga ke lo umthetho mlingwa ngombana kunabantu abaningi abanzima abangabandakanywako ikhiqizweni kwegwayi.
Mpumalanga accounts as the second biggest tobacco producer in the country after Limpopo.
Le province ke yeMpumalanga ingeyesibili ngokukhulu ekhiqiza igwayi ngemva kwesibili.
This bill is going to shrink the industry which will effectively kill their businesses and shed jobs.
Lo mthetho mlingwa ke uzokubulala ke ibubulo leli lokhiqiza igwayi.
I do not know whether to support the bill or not. It is because this bill seeks to regulate.
Angazi ke ukuthi ngilisekele lo mthetho mlingwa ngombana kubonakala ngasuthi lo mthetho mlingwa ufuna ukulawula.
This bill seeks to regulate tobacco and e-cigarette in a similar manner.
Kubonakala ngasuthi ke lo mthetho mlingwa ufuna ukulawula igwayi ngendlela efanako nofana lokho kuthiwa itobacco.
We see in other parts of the world such as United Kingdom and Sweden.
Siyabona ke kamanye amazwe afana neEngland neSweden
whereby harm reduced alternatives such as e-cigarette, nicotine patches and gums are embraced to assist smokers in quitting smoking.
Lapho ke kwenziwa imizamo imikhiqizo eminye esiza labo ababhema ukuthi babe nendlela ebalisa ngayo ukubhema.
Why is it that the government is not taking initiative in educate people about this product? And why is that the government wants to regulate this product in the same way as tobacco products?
Kuba yini ke uhulumende angabi nemizamo yokuthi afundise abantu ngale mikhiqizo yegwayi nokuthi ahlome imithetho ehlukileko yokulawula igwayi. Ngiyathokoza.
Sanbonani malunga weparlamenti.
Greetings to the members of parliament.
Komisa Su sakubingelela.
We also greet you, Commissar Su.
Ngibingelela wonke umuntu ozile kule ndawo zolalela le bill.
I also greet
Engakahlelwanga kahle.
everyone who came here to listen to this public hearing, which was not well organized.
Yeah. Okokuqala abantu beparlament
Firstly, members of parliament,
ngoba ningabantu beSouth Africa.
because you are South Africans,
Bengicabanga ukuthi before nenza le bill
I thought before enacting this bill or
nicabanga
starting
labantwana
with this
abafa
public
every
hearings,
day abadla inyawupe.
you should have thought about the children
Kahle
that
kahle
are
bekufanele
dying
niqale ngabo
every
kule
day.
bill. Hayi
People are
ngekwayi,
dying
ikwayi
because of
nankinga.
nyawupe every day.
Alinankinga ikwayi.
You should have not regulate cigarette. I don't have problem with cigarette because I'm not smoking.
Nisuka le parliament Cape Town.
You came all the way from Cape
Niza
Town.
la eMpumalanga.
You come here in
Nizositshela
Mpumalanga
ngegwayi.
to tell us about
Anisitsheli
cigarette.
iway forward ngabantu ababhema inyawupe.
You don't tell us or give
Anisitsheli
us a
iway
way
forward
forward
ukuthi
about
what can
people who
we
are
do
smoking
ngabantu
nyawupe.
ababhema inyawupe.
What must we do about people
Which
who
is
smoking
wrong.
nyawupe? Which is wrong.
Yazi inkinga yenu yini?
You know what's your problem?
Nihleli kamnandi eparlament.
You are comfortable in parliament.
Manisuka la no claim, manisuka le parliament no claim
When
ukuthi
you
ngize
go
eMpumalanga.
back, you are going to claim that
Uclaim
you
imali.
came to Mpumalanga.
Abantwana
You are
bethu
going to
bayafa la
get money.
ngaphandle.
Our kids are
I-wrong
dying
into
out
eniyenzayo.
there.
Go back to the drawing
It is
board.
wrong what you are doing.
Nolungisa le nto. Niku Department of Health nonke ngiyacabanga lapha.
I
Hamba
know you
nolungisa
are
le
all
nto
coming
yenu.
from the Department of
And
Health.
ngikwatile ngizubhlungu ngoba abantwana
I'm
bayabhubha.
angry because kids are
Abantwana
dying.
bayaphela eSouth Africa.
Kids are dying in South Africa.
My submission is as follows.
My izethulo zami zingalendlela.
Mpumalanga is noted to be the amongst poorest provinces in the country.
Impumalanga ke ngezinye zemfunda
The tobacco industry
ezihlagako.
pays more than 18 billion rands a year
Leli
in
bubulo
tax
ke
and buy the tobacco
legwayi
from the
lifaka
farmers
imali
in
eningi
Mpumalanga.
elivela ebalimini balapha eMpumalanga.
This bill will further drive the province into poverty and goes
Lo
against the
mthethomlingwa ke
economic
uzokwenza
and the
ukuthi
rural
lesi sifunda
development
siye emhlagweni.
efforts and the province. Our brothers and sisters who are selling loose cigar and tax ranks, uzangilandela. Buses in taverns. Okay, kokugcina ngithi. Labantwana bathengisa amagwayi ema taverns, ema ranks. Shukuthi banafanele abantwana babo bafe. Ngoba bathenga ukudla endlini.
The people who are selling cigarette at taxi ranks and
angivumelani nayo
taverns.
vele ngayirejecta
So, guys, I'm rejecting this bill.
Okay. Ngiyanibingelela, members of parliament. Ngibingelele nomphakathi wonke.
Greetings to honorable members of parliament and greetings to members of the public.
Okay. Igama lami uZinhle Ngcobo and ngiyilunga le Protect Our Next campaign.
My name is Zinhle Ngcobo. I'm a member of Next Protect campaign,
Protect Our Next campaign.
or Protect Our Next campaign.
Mina ngilapha namhlanje ngoba ngiyawusekela kakhulu lo mthetho.
I am here today to support this bill.
Ngiyawusekela ngoba If you see bambezela le bill, ilapho sizolahlekelwa izimpilo eziningi eSouth Africa.
Because if we delay enacting this bill, we are going to lose a lot of lives here in South Africa.
Ngoba njengamanje nje sikhuluma silahlekelwa abantu abangango 39,000 ngonyaka ngenxa yogwayi ngenxa yokuba exposed to second-hand smoking.
Because as we speak, we have 39,000 people have passed on because of cigarettes
And second-hand smoking.
and second-hand smoking.
Kanti no government usebenzisa imali engango 42 billion ukwelapha izifo eziphathelene nogwayi ne second-hand smoking.
And the government is spending almost 42 billion for diseases related to tobacco and second-hand smoking.
Lokho che ungavimbeka kalula uma singathi nje uqinisa umthetho ophathelene nogwayi ukwenziwa kwawo ukukhangiswa kwawo kanye nokusetshenziswa kwawo.
Chairperson, that can be mitigated only if we can strengthen our laws and regulatory mechanisms about advertising, sellings, and yes, and selling of tobacco.
Lo mthetho lo uzovikela thina singabhemi.
This bill is going to protect us non-smokers.
Ngoba ngalesikhathi umuntu ebheme eduze kwethu noba besifuqa ngogwayi besihamba emgaqweni nathi singazithola sesigula sesine cancer.
Because those people who are smoking, when they smoke next to people who are not smoking, those people who are not smoking can be affected and eventually have diseases like cancer.
Ngifuna futhi ukunxusa ugovernment ukuthi angawakhohlwa ama-happy favors nama e-cigarettes. Nawo akumele asetshenziswe noba kanjani noba yikuphi ngoba nawo ayas-affect.
I also want to plead with the government not to forget the hubbly-bubblies because and e-cigarettes because they also affect us as non-smokers.
Bengenza nje isibonelo chair bongase uhlale erumini nabantu ababhema ihabli noba ama e-cigarettes ugcina usophathwe ikhanda nawe ugcina sokungathi ufuna ukuphalaza ugcine futhi amakhala akho eblockekile.
If I can just make an example, Chairperson, if you can sit in the same room where people are smoking this hubbly-bubbly, you can have a headache, you also can vomit, and those are the side effects of
Umthethosisekelo uyasho ke lapha ku sigaba 24 A and B ukuthi sonke sinamalungelo okuphefumula umoya ohlanzekile. So lo mthetho lona uzobe uvikela amalungelo ethu.
As the Constitution correctly says in the referred section, that all people have a right to breathe clean air, that is our human right.
Into engiyithanda kakhulu ke ngalomthetho ukuthi uzovikela zona izingane lezi abakhuluma ngazo.
What I like most about this act is that it is going to protect the very same children we are talking about.
Ngoba baqala besabancane ukubhema ilapho bedlulela kona kwinsangu ilapho bedlulela khona kwizidakamizwe ezinjengeyiwunga.
Because they start smoking at a very early age and then they transition to other hardcore drugs like nyaupe and wunga.
Sengivala ke che ngifuna nje ukukhuluma kancane nge-e-cigarette ngisho ukuthi e-cigarette was not created or it's not advertised for ama-smokers to stop smoking.
In conclusion, Chairperson, may I highlight that e-cigarette is not designed to assist or mitigate or to assist people to stop smoking.
Lama company lawo it's just many business ngoba usobala ngendlela abayikhangisa ngayo lento especially kwama youth events la kukhona khona intsha lama company akhona anika intsha ama free samples.
Because I'm saying this because we have noted the way these companies, they mean business. We have seen the way they advertise these cigarettes and especially targeting the young people.
Leyo nto bayenza ngamabomu ngoba bayazi ukuthi waqala la uzoqhubeka njalo bona bayajabula ngoba bazoba ne profit yango.
Thank you, time is up.
They do that deliberately knowing that once you start, you are going to be addicted. Thank you.
Ngiyabingelela sihlalo ikomiti nomphakathi wonke.
Greetings, Honorable Chairperson, honorable members of the committee and members of the public.
Igama nguPhindile kwaNgobese.
My name is Pindile Ngobese.
Ngokomsebenzi ngingusosayensi eSouth African Medical Research Council.
I am a scientist at the South African Medical Research Council.
Ngiphinde ngibe umfundi owenza iPhD eSifako Makgatho Health
I'm
Sciences
also
University.
a PhD candidate at Sefako Makgatho Health Sciences University.
Ngineminyakana ke ngisebenza ngokucwaninga kwagwayi la eMzantsi Afrika.
I have been working on research about tobacco here in South Africa.
Eminyakeni mhlambe emithathu edlule ngikhipha iphepha elibuka ukusetshenziswa second hand smoking la in public places in South Africa.
A few years ago, I wrote a paper about second-hand smoking here in South Africa.
Ngisebenzisa ke iSouth African Social Attitude Survey.
And using South African attitude survey,
Ngathola ukuthi abantu babalelwa ku 47% aba affectwa by second hand smoking la South Africa.
and I found out that there is 47% of population who are affected by second-hand smoking here in South Africa.
Meaning nearly 50% wabantu eMzantsi Afrika ba affectwa second hand smoking.
Up to 50% of South Africans are affected by second-hand smoking.
Ngaphezu kwalokho kusho ukuthi laba abantu basengcupheni yokugula.
Over and above that, it means that those people are at a risk to contract diseases.
Manje ke uma begula ubani ozosebenza eSouth Africa ukukhulisa umnotho.
Now, if they contract these diseases, who is going to work here in South Africa
And grow our economy.
and grow our economy?
Okwesibili ngenza umcwaningo lolubuka ukusetshenziswa ukwagwayi lesisithu sinemfu.
Secondly, I also do research about snuff,
Ukusetshenziswa kwakho ngokwesintu nokusebenziswa kwakho njengesimanje manje.
its usage traditionally as well as how it is used currently.
Ngiyalithola ke ithuba lokuphuma ngihambe ngiyokhuluma nomphakathi, ngikhulume nabalaphi futhi bendabuko.
I do get an opportunity to go out in public and engage the public as well as traditional healers.
Kuze kube manje akekho umlaphi wendabuko ovumela ukusetshenziswa kwesinefu futhi noma kanjani.
Up to this point, there is not even a single traditional healer who agrees that the snuff can be used anyhow.
Siyavuma ukuthi kubalekile ukusetshenziswa kwaso ezintweni zesintu.
We do agree that it is important for traditional use.
Futhi nebill ayicindezeli umuntu ukuthi ayisebenziseli lokho.
And the bill does not oppress anyone not to use it for traditional purposes.
Ayizili ukuzovimba ukusetshenziswa ugwayi ezintweni zesintu.
It is not coming to stop the usage of tobacco for traditional issues.
Kunalokho izovikela laba abayisebenzisa ngendlela engesiyo mase bevika ngokuthi bayisebenzisele izinto zesintu.
But it is going to protect those who use it not accordingly, especially for traditional use.
Sengivala sihlalo uma ukhuluma nabantu aba-addicted to isinemfu inkinga ibala.
In conclusion, Madam Chair, when we look at the people who use this snuff, the problem is here.
Bathi bayathanda ukuyeka.
They say they want to stop smoking or using.
Kodwa sebengene ngendlela yokuthi sekunzima ukuthi beziyekele bona.
But because of the level of addiction, it is very difficult for them to stop.
Uthola bengazi ukuthi benze njani kumele bethenge isinkwa noma bethenge ugwayi.
Sometimes they find themselves in the middle whether they should buy bread or they must buy the snuff.
Kodwa bazithola bethenga ugwayi ngoba abakwazi ukuphila ngaphandle kwabo.
But because of the addiction, they end up buying a snuff because they can't live without it.
Bakhala ngokuthi umndeni nezingane ziyahlupheka ngenxa yogwayi asebengene kuwo.
They complain about children and their families. They are suffering because of their addiction.
Isizwe sinjani esikhetha ugwayi over ukudla?
What kind of a nation chooses tobacco over food?
Ngiyacela siphase le bill, ngiyabonga.
I'm pleading with you to pass this bill. Thank you very much. interpreting this. We can speak.
Thank you. Honorable Chair, honorable members of the committee, I thank you very much.
Sihlalo hloniphekile malunga hloniphekile weParlamente ngiyabonga kakhulu ngaleli thuba.
I'm Francois van der Merwe. I've vast experience in the tobacco industry.
Mina nguFrancois van der Merwe nginesipiloni esiningi kulemboni yezogwayi.
I've been in tobacco farming for 39 years.
Ngisebenze kulemboni iminyaka engamashumi amathathu nesishagalolunye.
And I have and still serve the whole value chain of the sector on various boards and institutions.
Kanti namanje ngisawusebenzela lo mkhakha ke ngisebenza kuma board kanye nakuzikhungu ezihlukile.
I was also the president globally of the International Tobacco Growers Association.
Futhi mina bengu president we Tobacco Growers International Tobacco Growers Association.
And I was involved in policy formulation in legislation from South Africa in the early 90s right up to the FCTC level globally.
Kanti futhi ke nami ke ngiye ngaba nethonya ngabamba iqhaza ekwakhweni kwemithetho la eningizimu Afrika kanye nakumazwe ngamazwe.
I humbly submit that I think I know what workable regulation looks like.
Ngicabanga ukuthi isethulo sami ke ukuthi ngiyazi mina ke ukuthi isisombululo kungaba into enjani kulokhu.
I want to try and assist the committee by making 7 short points.
Ngizozama ukuthi ngilekelele leli committee ngokuthi ngenza amaphuzu ayisikhombisa nje kafuphi.
I and the whole value chain that I represent oppose and reject this bill in its entirety.
Mina ke nazo zonke ke izikhungu engizimele kulemboni siyayiphikisa siyayichitha lo mthethosivivinywa.
I fail to understand why the committee's time is wasted by a bill which is not written by the DOH, it's written by NGOs, funded by philanthropists, it's not written for South Africa, it is cut and paste from first world countries, and it doesn't reflect the South African realities at all.
Ngiyahluleka ukuzwisisa ukuthi kungani ikomiti lichitha isikhathi salo ukuthi ke lizodingida lo mthethosivivinywa njengoba bangawubhalanga kubabhalelwe ezinye ke izinhlangano zamazwe ngamazwe ukuthi bakwazi ukuthi baqhubekise izinjongo zabo.
The bill must be sent back. A socio-economic impact assessment must be done. A cost and benefit analysis must be done. It must be tabled before Parliament because before your scarce resources and time and precious time is used for this bill. So it must go back through those processes. The presidency insists on a socio-economic impact assessment. Where is it? It's nowhere. The last one was done in 2018.
Mina ngizocela ke ukuthi lo mthethosivivinywa ubuyele emuva ngoba ke kufanele ukuthi kube khona ucwaningo kumthelela wezomnotho endaweni nokuthi kube khona ucwaningo lezindleko ezizobandakanyeka kulokho nokuthi lo mthetho ubiselwe eParliament ukuthi baze bawudingisise bakwazi ukuthi bawudingide kahle ke lo mthetho ngoba ke yiyo inqubo ekufanele ukuthi yenziwe uma kwakhiwa umthetho.
Next point, you cannot align local legislation with international legislation if your market does not reflect the realities of the country that you make the regulation for.
Okunye futhi ukuthi ke ngeke ke niqhathanise umthetho osuwenzayo la eningizimu Afrika neminye imithetho yamazwe ngamazwe noma amanye amazwe aphucukile ngoba ke kufanele ukuthi sibhekelele isimo sala ekhaya kulelizwe lethu.
The average size of illicit tobacco markets worldwide is 11 to 13%.
Imboni ya logwayi womgunyathi kumhlaba wonke cishe u11.3%.
11 to 13%.
Oh ngiyabonga 11 to 13%.
So there's enforcement, there's a level playing field, and legislation can deliver results.
Kukhona ke ukubhekelela ukuzibandakanya nomthetho ukuze kubhekelelwe ukuthi zonke ke izinhlelo ziyahambelana.
In South Africa, 2/3 of the market is illegal, so no legislation, you can make 10 laws, will have an impact if you don't start enforcing your current laws.
La eningizimu Afrika u2/3 kule market umgunyathi ingakho ngisho ukuthi noma ningayenza ziphi izinyathelo noma imizamo angeke sikwazi ukuthi sisombulule lokho.
Chair, if you want to regulate anything, you need to understand properly the whole sector and the product that you want to regulate.
Uma ke sifuna ukuthi silawule umkhakha othile kufanele ukuthi siuzwisise kahle sizwisise nemarket leyo ukuthi sifanele ukuthi siqondane nayo.
Unfortunately, your time is up, sir.
Give me 2 minutes, Chair.
I've already give you 1 minute.
Give me 1 minute more, Chair. Give me 1 minute, I beg you.
You can still hang it to the table. Just go that side.
Let me make one last comment, Chair.
30 seconds.
You discriminate against me, madam. The main issue for the committee, Chair, is how and why do you think this bill will reduce consumption in South Africa, with which we agree, if only 1/3 of the market will comply? That is the question you need. And with the draconian measures in the bill, you will create opportunity for more non-compliance. The illegal industry will grow more, prices will drop, consumption will increase, and we will have egg on our faces.
Hear you.
Thank you, Chair.
Okugcina ke bengithi ngizwe ukuthi ngicabanga ukuthi lokho kuzoyehlisa kanjani ukubhenya kogwayi. Ngoba kuzoba ingxenye kuphela yelemboni ukuthi inamathela kulemthetho. Yikho lokho bengithanda ukuthi ngikuphawule.
Bengicela ukunicela bahlali baseMpumalanga with due respect ukuthi let's respect time. All of you want to speak, you want to make your input in this bill. So if I'm going to allow a person more than what is being allocated to others, it's unfair. So ngiyanicela ningangihawuli.
Bengicela ukuthi nginicele bahlali basemalahleni ukuthi sinamathele kuleso sikhathi esivumalene ngaso ngoba omunye makacela ukuthi ke ngimandisele isikhathi nabanye bazocela kube njalo kanti ke bengicela nje ukuthi sihambise kahle ngohlelo ngiyazicelela.
I'm going to take this side.
Manje sengizothatha izandla kule ngxenye.
I'm going to start at the back.
Siqale khona le muva.
With the guy owe cap.
Nangu ugqokepisi ubaba lapho.
Ngize ngobhuti next to le emva, the two hands at the back. Nobabili, both of you. And this ngosisi lapha ecaleni. Then the guy with the red t-shirt, SACP. The guy with the black t-shirt. The lady at the back. Yes, you. And then the guy with the white t-shirt. The guy with the red t-shirt, also the back. The lady. Ngizabuye ngithathe ezinye izandla la ne.
Sanmonani, good morning, goeiemorgen.
Greetings.
Kaufela lona. Kena Thabo Marago.
I am Thabo Marago.
Community member, parent.
A community member, a parent.
And a worker. Man, I'm standing here humbly, coming to beg the members of parliament
Ke eme mo ka
Under your
boikokobetso.
leadership, I'm saying.
Ke tlo kgopela maloko a parlamente ka tlase ga ketopele ya
Our reality is not for scientists to prove.
nnete ke gore a se gore bo rasaense swantše ba ntšhe bohlatse.
Our reality is for everyone to see outside.
nnete ke gore motho yohle o swantše gore a bone ka mo ntle.
We are a third world country, we can't run away from it.
Rena re lefase le e leng gore le sa ithweša ka letolo.
So that will tell you
Ga
that-
gona o e leng gore a ka phiriša seo.
We form part of those who are categorized as the poorest of the poor.
Re karolo ya ba e leng gore ba ba bitša gore ke bona ba šilang ba hlahlegileng. Ga bana selo ka mantswe a mangwe.
I will say the natural thing that will happen for parliamentarians, the government and the leadership is to create jobs.
Ke rata gore se
That will be
e
the
leng
natural
gore
thing to do.
ke sona se emetšweng go tšwa malokong a parlamente ke gore ba swantše ba hlole dikgoba tša mešomo.
So now we come to these proceedings and we see that there may be this legislation that might be turned into a law, a bill that might turn into a law that might naturally finish jobs.
Re tlile mo re tlo latela tshepedišo e leng gona mo e leng gore go na le molao o kakanywa o e leng gore o ka feleletša o dirilwe molao e be molao o e leng gore o ka feleletša o feleletša mešomonyana e leng gore e šetše.
I cannot say for sure that what informs this kind of processes that may want to legislate such laws. But what I would say is we need to be very, very careful.
Nka se ke ka bolela gore gabotse ke eng se se napileng se dira gore le tle mo le dire molao ka kwana o eupša swantše gore re tloge re lebelelešiša.
Whether be it science or be it World Health Organization or whichever organization might be at the back or at the forefront of such laws, we also need to look at them and scrutinize them as to whether are they doing good for the people of South Africa and the employment of the people of South
E ka tlo ba
Africa.
mabaka a science goba yona World Health Organization. Re swantše gore re lebelelešiše gabotsebotse gore a na se e leng gore ba se dira se ka hlahloša maphelo a batho ba Afrika Borwa goba se ka phuhlamiša maphelo a bona na.
Now I'm standing here against the bill.
Jwalo ke mo ke kgahlanong le molao ka
I'm
kanyo.
saying no to the bill, not until we become, not until we become absolutely sure that we have employment of as much people as possible in our country.
Ke tla ba kgahlanong le ona go fihlela re netefatša gore batho ba bantši ba hweditše mešomo.
For as long as there is so much youth unemployment,
ge go sana le batho ba bantši ba e leng gore e leng ba baswa ba e leng gore ga ba šome,
my position will forever be the same.
nna
It will be no to the bill.
ke tla no dula ke le kgahlanong le molao ka kanyo.
Thank you very much.
Ke ya le leboga go menagana.
Good day, ladies and gentlemen.
Thobela.
My name is Howard Matobela.
Leina la ka ke Howard Mathobela.
I'm standing here as an employee of British American Tobacco, as a member of community.
Ke eme mo bjalo ka leloko la setšhaba ebile ke šomela British Tobacco.
And I'm even a smoker.
Ebile ke mokgori.
I want to submit that I am against the bill in its entirety.
Ke rata go bea go lena gore ke kgahlanong le molao ka kanyo.
The first thing that I would like to say is that I abide by the current laws of smoking.
Sa pele se ke ratang go se bolela ke gore ke obamela melao ye e leng gona ga bjalo ya go goga.
even though it's not being enforced by anyone.
Le ge e leng gore ga gona motho a latelelang go netefatša gore melao yeo e ya obamelwa.
The bill that is being proposed,
Molaokakanywa wo e leng gore o gona mo pele ga rena,
according to me, it looks like our government just want to create unemployment instead of creating employment.
go ya ka nna go itaetša o kare mmušo wa rena o nyaka go feletša batho mešomo mola e le gore mmušo o swantše o hlole dikgoba tša mešomo.
Let's find solutions to the current economic environment.
Ake re be batho ba e leng gore re hwetša di-solutions tše e leng gore di lebane le tlhokego ya mešomo
instead of killing our economy.
go na le gore re bolae economy ya rena.
Let's find workable solutions on this bill.
Ga re hwetšeng tsela e itšeng e leng gore e ka re thuša mo molaong kakanyweng o.
And I thank you, and I still stand by saying that I am against the bill.
Ke a le leboga ebile ke sa buša ke re ke kgahlanong le molaokakanywa o.
Sanibonani.
Good morning.
Igama lami nguZenzele Mabi.
My name is Zenzele Mabi.
And ngithanda ukusho ukuthi ngi-against ibill.
I would like to say I oppose the bill.
Ngi-against ibill ngoba ibill iphasile kuma-country a-civilized. La eMzansi sesenenkinga enkulu yemisebenzi. Asikwazi ukungaqeda imisebenzi kucala esinganayo already ukuthi sifane nama-country a-civilized.
I oppose the bill because yes, the bill has been passed in other countries, but here in our country, we still have a problem of unemployment. So we can't support the bill that will also not create more jobs in our country.
Exactly. And manje inkinga enkulu ukuthi okay, we understand ugwaya ukho healthy, but so is izinto eziningi aboma ration aboma chips azikho healthy. Mara kusho ukuthi sizistophe. And abantu ukuthi abantwana babhema basesebancane inkinga leyo, but inkinga yomzali nomntwana angeke kublame ugovernment for lokho.
We understand that tobacco is not healthy. We do understand that tobacco, just like other food, it's not healthy. But that it's not a problem for government. It's a problem for parents who must teach their children.
Hey, ukuthi lo gwayi lo legally o complyayo uyavalwa. Umntana khoma ngakhona kumgada uzowubhema lo ngekho legal. Uzowuthola uzowubhema.
If you don't teach your children, definitely he will be able to find the cigarette and keep on smoking.
So inkinga enkulu lana ukuthi ama parents awakwazi ukuthi makahluleka ukuguide umntana wakhe afuna blame government for long.
The main issue here, it's about parents. If the parents fail to teach their children, they can't blame the government for that.
Because masithi yabheka ugwayi uyacomply ubhaliwe iminyaka ubhaliwe ama dangers wakhona. Abantu mabangamameli akusi problem ka government or yomunye umuntu.
Because if you look the cigarettes, there is labeling on it that tells you that cigarette is danger, so you can't blame the government for that. If people, they don't want to listen.
And angaze ama-study okuloku khulunywa ngawo lana ukuthi abuyapi. But mina personally awekho amathuna amaningi engawakhomba ugwayi. Unlike alcohol, inyawupe and stuff like that.
I'm not sure about the research that people are keep on talking about it, because right now I cannot show you any graves that caused by smoking, but I know when it comes to alcohol.
So in conclusion, lokwayi lo uyakhona ukubhadala i-tax and uyakhona ukuthi uncede nakuwo lama student ukuthi athole ama bursary and stuff. So ngicela ukuthi ugwayi uyeke uthengiswe and stuff. Thank you.
In conclusion, let's allow this cigarette because it helps people also, first of all, for revenue, as well as helps other students to do their studies. Thank you.
Ngicela simameleni ispeaker ne silandelayo.
Ngiyanibingelela.
Igama lami ngingo-Andile Khumalo, ngirepresenta iSAIC, South African Youth Council province.
My name is Andile Khumalo. I represent SAIC.
First of all, I like to reject the bill.
Okokuqala nje ngithanda ukuwenqaba lo mthetho sivivinyo.
As I'm here, I like to speak more of young people, angihlala nabo around la ngihlala khona. And nami ngiyang ngikhule nabantu ababhemayo a lot. Most of
Njengoba ngilapha ngifuna ukukhulumela abantu abancane since I'm also young and I also grew up with young ones who are also smoking.
Most of the young people who are smoking tobacco, their situation and health is not ajabulisi. So, mongaya nasesanka uyo checka, most of the people abagcwele lapha, abantwana abancane, they are diagnosed with TB and other diseases.
Ibo ubheka impilo yezingane ezincane ezibhemayo, impilo yayo yayinhle kakhulu. Even if you can go to Sanka, you'll see that their health is not good at all.
So I don't want to say much about the economy because even if this tobacco can make a lot for us to improve the economy, but young people are unemployed and there's a high rate of unemployment of young people. So it's not assisting us at all.
Angifuni ukukhuluma kakhulu ngezomnotho ngoba izingane eziningi njengamanje azisebenzi ngakho ngicabanga ukuthi nalokho kokwaye kungenza umehluko otheni uma kuziwa kulokho ngoba abantu abaningi abanawo umsebenzi.
Bengingathanda nakhona ukuthi kube ne-strictly umthetho policy yokuthi ugwayi kuthengiselwa abantu abangakanani because labantwana abancane ayivumelekile uthola akusimnandi ukuthola umntana or the age of 10 or 6 athi ayothenga ugwayi or umthola dobhizdombi abhem because of ubone ngomuntu omdala.
I would like that if you can have some age restrictions when it comes to tobacco or any cigarette products because it's not good to see young child smokes at the age of 10 and others are being sent by their parents to buy cigarettes.
So ayikho into engingayisho but okuningi ukuthi ngiyirejecta ibill.
Nothing much I will say, but I reject the bill.
Sanbonan,
Good day.
Kamalamu Given Maisela
My name is Given Maisela
from the South African Young Communist League.
from South African Young Communist League.
Ngizocala lana quote from Lao Clause 3.
I would like to start to quote clause 3.
Clause 3 says provides for the prohibition of advertising, promotion and sponsorship of tobacco products, relevant products and related products.
Clause 3 ukhuluma ngokuthi uzohlinzeka ukunqandwa noma ukuvinjelwa kokukhangisa nokuthuthukiswa noma ukuxhaswa kwemikhiqizo kagwayi.
So I reject this bill.
Ngakho ngiyamwenqaba lo mthetho sivivinyo.
This bill seems to oppress businesses that are clients to the tobacco producing companies, doing marketing, advertising and promotion while the country is already on high unemployment rate. So I reject this bill.
Lo mthetho sivivinyo mina into eyenza ngwenqabe ukuthi kubonakala sengathi umelene nokwakhiwa nokuhlinzekwa kukagwayi ukusakazwa kwawo ukukhangiswa kwawo nokuthuthukiswa kwawo ngenxa yaleso sizathu ngiyawenqaba.
Sanibonani.
Greetings.
Ume ngaphambi Sabelo wakangwenyo.
My name is Sabelo Ngwenya.
I reject this bill.
Nami ngiyawenqaba ngempela lo mthetho sivivinyo.
Ngoba why bebangaqali ngani with the legal substances lebheme abantu abasha among our communities bazocala ngento illegal. Ube bayazi ukuthi izo oppressor yini economy yethu even nani unemployment rate ala le countries phila kiyo.
The reason is that you should have started with the illegal drugs that are in the community right now as we speak, instead of coming to something that is legal, which is tobacco.
And the most worst point of it, ukuthi akekho ngawazi ukuthi sime ustandard esinjani kule country via economy, even nani neumsebenzi ukuthi umsebenzi ayikho bese siyabuya futhi sifuna ukuthi safule futhi still kweminye imisebenzi ezami ucreate ezinye indlela.
No one is not aware in the situation that we are in right now as we speak when it comes to our economy. So now why do we want also to reduce some things that has been created in order to create jobs for our community?
Yeah, ngiyabonga, and can you please sameni ukuthi sicale ngalento esingasi illegally maybe singawusiza yini umphakathi wethu even country ukuthi bengcono kulempilo esikiyo namuhla.
Thank you. Let's start with all those things that are illegal in our country. I think by so doing, we can improve our lives in our community.
Ngibingelela laba phambili kwami i-community and igama lami ngimlungile ngibuya la Mpumalanga ngiphindze ngibuye South African Medical Research Council.
I would like to greet the portfolio committee in front of me as well as the community. My name is Lungile. I come from the Research Council
And in Mpumalanga.
here in Mpumalanga.
Okay, so I am in full support of the bill and
Angisho ukuthi ngiusekela ngokugcwele lo mthetho sivivinyo.
And I just want to clarify, Uguti, the Department of Justice and Correctional Service has a bill which speaks about other drugs such as nyawupe and wunga, but le bill lesletelana, it's about tobacco products and electronic delivery systems.
Ake ngicacisele. Angicacise ukuthi umnyango wezobulungiswa kanye nokuhlunyeleliswa kwezimilo unawo umthetho sivivinyo okhuluma ngezinye idakamizwa ezinjengenyawupe. Kodwa lo mthetho sivivinyo sikhona esize ngawo lapha wona ugxile emkhiqizweni kagwayi kanye nasendleleni yokudlulisela kulabo awusebenzisayo.
Kunjalo nje, having pictures on packets and of cigarettes and also, having pictures on packets of cigarettes nekungaba right for bantu labangakhoni kufunza nalabangakhoni kubona futhi. And kunjalo nje nginembono for le bill le.
I think at the same time to have some labeling as well as pictures outside of the packages, it can also assist to people who are not able to see, people who are blind, so now it can also help them. I also have some opinions when it comes to this bill.
Esikhathini lesiningi masikhuluma or masifunza kuba namagama lamakhulu lesingawa understand, so if letinto letibhaliwe kuleli bhokisi tingaba lula abantu bangakhona kufunza labangakafunzi kudzala and labangaboni bangakhona ukuthi babambe libhokisi ba understand ukuthi lento lena i-wrong kangakanani.
In many times when they write, they use technical words that are not easy to be understood. So now if they can try to simplify what is written on the box, on the package, that can also help everyone to understand what is written, even those who are not able to see.
And then kunjalo nje labanye bangachazela labangakhona ukufundza nokungaboni and lemunye umbono ukuthi ma nifaka ma board nithi kungabhenywa ngicela ukuthi kubhalwe kube kukhulu so that labangakhona ukubona bagcoka tibuko babone because esikhathini etiningi kuba ne sign lethi akuvunyelwanga mara lento lethi ku dangerous ibe incane so ngiyabonga ngaloko nje ngiyayisupport.
Another thing, other people can also assist those who do not understand it if they try to explain it to them. And to add on top of that, I would like that if on our billboards is written, they should use bigger words so that even people who use the eyeglasses, they can be able to see what is written on those billboards.
Thanks, Chair.
Ngiyabonga sihlalo.
My name is Robert Malachi,
Igama lami uRobert Malachi.
a community member from Beggarsford, working for British American Tobacco BAT.
Ngilungu lomphakathi eBeggarsford kanti nami futhi ngisebenzela le forum ye American British
American Tobacco.
British American Tobacco.
Let me first state here that I strongly reject the bill.
Angiqale ngokusho nje Zibekwa ukuthi ngiwe nqaba kakhulu ngokuphelele lo mthetho sivivinyo.
I reject the bill with these conditions. We're not saying that the bill says ban or it says regulate or whatever. I just wanted to highlight or educate the first speaker who talked about the bill does not say ban but regulate.
Angeke ngiqale ngichaze ukuthi ngiwe nqaba ngamiphi imbandela. Angisho ukuthi umthetho sivivinyo uthi uzovala ukusetshenziswa kwagwayi njengoba ukukhona isikhulumo eseke sasho ngaphambili kodwa siyaqonda ukuthi uzonikeza iziqondiso zokulawula.
We currently have the bill regulating the sale and advertising or distribution of tobacco products.
Njengoba
So-
sikhuluma nje sina umthetho sivivinyo oqondisayo ukwabiwa kanye nokukhangiswa kwezimkhiqizo kagwayi.
The bill in itself, it's discriminative.
Kodwa kwawona lo mthetho sivivinyo ngokwawo uyacwasa.
It doesn't talk about protecting the law-abiding citizens, our traders that are abiding by the laws.
Awukhulumi ngabantu abalalela nabahlonipha umthetho ngokwesibonela abantu abathengisayo bebe bethobela umthetho.
Another education to my learned friend from Sifago Makhato, the PhD one.
Enye kunye imfundo lapho engifuna ukuyidlulisela komunye uzwakwethokwe wakhuluma ovela kufundela iPhD
My
njengamanje
learned friend does not understand or know where these people are. She talked about people instead of buying bread, they're buying cigarettes. Which cigarette are they buying? You will find in the market that the cigarettes sale, the price of a illicit cigarette, it's less than the price of a loaf of bread. So it's not the legal cigarettes that the people are buying out there. It's the illicit cigarettes that they are buying, which is cheaper than the loaf of bread.
Ukhulume ngokuthengiswa kwagwayi wathi abantu bakhetha ukuthenga ugwayi kunokuthenga isinkwa kodwa akakwazi ukuhlukanisa ukuthi kanti abantu abasuke beyithenga basuke bethenga lo gwayi womgunyathi ngoba phela umgwayi womgunyathi ushibhile uma uqhathaniswa nogwayi ovamile.
Comrade Stumo, in the president's speech, the president indicated that the government in itself cannot afford to create employment for everyone. The private companies should be helping the government to create employment. So in this case, if you look at the farmers, the traders, whoever is currently there dealing with legal tobacco products, these people are trying to create jobs. So if we come in here and say that we need to create a new bill, so are we saying that we're creating bills for the sake of creating bills now? Because we currently have bills that are regulated to tobacco product. Why are we not enforcing that before we can come up with new ones? So when you go back to the parliament, please, Comrade Stumo, advise our president in the rightful manner. Not what we're seeing currently here. People coming in with scripts, they don't even know what they're talking about. They come in with written statements that they've been given, and what is it that they're talking of? I can guarantee you, they don't know what they're talking of.
Comrade Stumo, enkulumeni yakho mongameli wakhuluma wachaza ukuthi uhulumeni ngeke akwazi ukwakha umsebenzi yena ngokwakhe. Abantu kufanele bazakhele neinkampani ezizimele ziwakhe umsebenzi. Manje naba abantu abalimi bayawakha ke manje umsebenzi. Manje kwenzeka kanjani ke manje ukuthi kuqhanyukwe neindlela esezivala lamathuba aleyo umsebenzi yakhiwa inkampani ezizimele. Ngoba manje uma ulalelisisa kahle abantu abeze lapha bazokhuluma abanye abakwazi nalokho abakukhulumayo. Uyabona nje ukuthi babhalelwe lezi zinto ukuthi bafike bazifunde lapha bebengaqondi ngempela ngokuphelele okukhulunywayo. Ngakho ngomusa ngiyacela ukuthi uma niphindele emuva umbonise umongameli lamaphuzu engiwashilo.
In closing,
Sengiphethe.
let's help the government fight crime and illicit trade that is currently crippling our nation in the country. Thank you.
Masimsize uhulumeni ukuba alwisane nobugebengu obukhona kanye nokwanda kwalugwayi ongumgunyathi ohlasele izwe lethu.
Ngithanda ukubingelela ikomiti ngokuphelela kwalo.
Greetings to honorable members of the committee.
Nomphakathi ngokuphelela kwawo la eholweni. Igama lami nguDumisani Hlatshwayo. I'm a fowl shop steward at the plant level.
May I also greet the public members present here today. My name is Dumisani Hlatshwayo.
Hlatshwayo is a shop steward at the plant level.
Or I am a shop steward at a plant level for fowl.
Yes. I'm here rejecting the bill in its entirety.
Mina ngize la ukuphikisa lo mthethosivivinya ngiyawuchitha njengoba unjalo.
As a parent, I also want us to, when we say we reject the bill, you must understand us. There's no parent in his good mind that can encourage his or her child to smoke or drink alcohol.
Njengoba ngithi ngiyawuchitha lo mthetho angusekeli njengomzali ngicela ukuthi ningizwisise kahle nje ukuthi akekho nje umzali ungakhuthazela ingane yakhe ukuthi ibheme noma iphuze utshwala.
Into nje esifuna ukuthi siyicele ku government is the government to reprioritize, because currently our main problem is illicit trade, not the legal cigarette that is sold on the market. The illicit trade is a problem.
Into esizama esithanda ukuthi sicele kuhulumeni ukuthi ke bakwazi ukuthi babeke okuse into ebalekile ibe seqhulwini ukuthi babhekane nalogwayi womgunyathi ngoba yiyo inkinga esibhekane nayo.
Because the legal market, the legal companies, if they can be closed tomorrow, but the illicit market will still be here. The problem will still persist.
Ngoba ke lezo zinkampani ezithambela umthetho noma zingavalwa nje kusasa kodwa ke le market yomgunyathi yona izohlala ikhona.
So killing the legal market that is contributing to the tax without anything to replace it, I don't think that's a good idea from the government side.
Manje ukubulala lemboni ukuthi yona iyakwazi ke ukuthi ke iphonse esivivaneni ngokwenza amathuba wemsebenzi futhi kungekho nje nento ukuthi iyo ezovala leso sikhala ngibona nje kuyinto engazwisiseki.
Because currently it's difficult to fight illicit trade which is not regulated. You could imagine if illicit now is thriving on its own. They are monopolizing the industry. What will they happen? What will happen there?
Ngoba njengoba sikhuluma nje kunzima nje ukuthi kulawulwe le market yegwayi lomgunyathi manje ngiyazibuza nje ukuthi kuzowenzekani uma ukuthi ke sokuyiyo kuphela njengoba inganamatheli kwimithetho kuzokwenzekani.
I would also like to share that what Business Unit South Africa has declared.
Ngithanda ukuthi ke ngicobolelane nani ngalokho kukhulunywa yi-Business Unity South Africa.
They said illicit trade is one of the biggest threat to stability and economic growth in South Africa.
Bathi lemboni yogwayi womgunyathi yiyo ke inqinamba enkulu ekukhuleni komnotho waseningizimu Afrika.
Ngakho lokho ngithi ngicela nje ukuthi le bill ayibuyele emuva so that it saves the jobs that the small jobs that we currently have. Let's focus on this illicit trade. Then we can talk about the bill later. Thank you.
Bengicela ukuthi lo mthethosivivinywa ubisole emuva eParliament kubhekanwe nalo ugwayi lomgunyathi yikho ke lokho engikushoyo ngiyabonga kakhulu.
Sawubona sihlalo namalunga e-committee igama uSiphesihle wakwaGwambe.
My name is Pesihle Gwambe. Greetings to Chairperson and honorable members of the committee.
Ngisebenza e-South African Medical Research Council as a senior research technician.
I'm a senior research technician at South African Medical Research Council.
Ngithanda ukusho ukuthi ngiyawusekela lo mthethosivivinyo.
I support this bill.
Chair, ngicabanga ukuthi kubalekile ukucacisa ukuthi lo mthethosivivinyo ufuna ukuqinisa imithetho ezovikela izimpilo zabantu eNingizimu Afrika.
May I note, Chairperson, that this bill is going to enhance regulation of tobacco products here in South Africa.
Ngeke uze unqabe ukuthi abantu bakwazi ukutshala itobacco noma ukudayisa ugwayi.
It is not going to ban people from plowing tobacco or selling or using tobacco products.
Chair, ngicela ukukhuluma ngeplain or standardized packaging.
I want also to talk about standardized packaging.
The packaging of tobacco and nicotine products such as Habli Babli and e-cigarettes plays a role in the marketing of these products.
Ukufakwa kumaphakethe walemikhiqizo yogwayi yiyo ke enethonya kakhulu kulokho esikhuluma ngakho kuya ngalomthethosivivinywa.
It is the most visible thing to consumers and it is often colorful with limited information on the actual harms of tobacco.
Ngoba khona ke kuyabonakala kakhulu kulabo bantu abathengayo kanti ke futhi ke izixwayiso ke lapho zona azibonakali kakhulu ngoba ke kubhalwe kancane ngezixwayiso.
It is not enough, Chair, to only have smoking kills on tobacco packaging.
Ngoba akwanele nje ukuthi sibhale ukuthi ukubhema kuyabulala kulawo maphakethe kagwayi.
Kufanele kube nezixwayiso zempilo kanye nezithombe kwamaphakethe agwayi.
There must be health warnings as well as pictures on packaging.
Lokho kuzofundisa abantu ngobungozi bagwayi njengehabli nevape.
That will educate people about the dangers of using tobacco products like Habli Babli.
Lokho kuzoqiniseka ukuthi izingane ezincane abantu ababhemayo futhi nabantu abangabhemi bazokwazi ukubona ukuthi le tobacco le ihama kanjani.
This will make people aware, especially children, non-smokers and smokers, about the dangers of using these tobacco products.
Ngiphinde ngikhulume nge-100% smoke-free indoor and certain outdoor places.
I also want to talk about the 100% smoking areas indoors and outdoors.
Currently, uma uya kwezinye indawo zokudla nezokuzijabulisa,
when we go to recreational facilities and restaurants,
uzobona abantu babhema ihabli noma e-cigarettes phakathi.
You find people smoking Habli Babli inside those places.
Lokho kusho ukuthi izingane ezincane nabantu abadlayo
That means that people who come to the restaurant as well as young children,
even waiters in restaurants and bars are not protected from second-hand smoking.
kanti nalabo abasebenza kulezo zindawo zokudlela nabo abavikelekile kulabo ababhemayo.
These people, Chair, did not make the decision to.
Bona abathathanga isinqumo sokuthi babheme.
Ugwayi ubulala abantu futhi asidingile ucwaningo from the US or Sweden to tell us that cigarettes kill more than 30,000 people in South Africa.
Smoking kills, and we don't need to research from other countries to verify that smoking has killed about 30 people here in South Africa. 30,000 people here in South Africa. Thank you, thank you.
Chair, it is absolutely the government's responsibility to protect the health of all of its citizens.
Kuyilungelo noma umsebenzi kahulumeni ukuthi avikele zonke bonke abantu abahlala la eNingizimu Afrika.
Thank you.
Ngiyabonga kakhulu.
Thank you very much.
Siyabonga kakhulu.
I'm going to take the second round of hands.
Sesizothatha ezinye izandla.
I'm going to start this side this time. I will start here with the lady with the white t-shirt, followed by Yuma. Then you'll be the third. The guy at the back with the shirt. The guy with the blue t-shirt. The guy with the black shirt. The lady at the back with the white and striped t-shirt. The guy with the navy t-shirt. The guy at the back who is standing with the t-shirt. And then lastly, the guy in the middle. I'm still coming on this side. Can you please listen to the speakers?
Greetings.
Dumelang, ka lebitso ke nna Lucy Madie and Madilu.
Greetings, my name is Mabusi Madie. Busi Madie. Lucy Madie.
Ke tswa ke le from that 5 and I fully support the bill.
I am from SAR 5 and I fully support the bill.
Before ke tlhalosa tse dingwe ke nyoko ho clarify dilo tse ding tse horeng a re di tlhaloganyo.
Before I explain other things, I wish to clarify some things which we do not understand.
Chair, most people are worried about their jobs, and then there's a whole lot that could be done. Instead of planting tobacco, why let's plant sunflower, because inflation is good and oil is very expensive and hona no re busy re bolela ka tobacco. Oh, sorry.
Chair, most of the people are worried about jobs. Why can't we plow tobacco?
Sunflower
Why can't we just plant sunflower
instead of tobacco,
instead of tobacco?
because no matter by day.
Because we do not have jobs at this stage.
And Omongwe mentioned hore the street vendors, they're not gonna survive. Kantelor barekisa di kwa e fela na.
And someone indicated that street vendors will not survive. Then the question is, are these street vendors only selling cigarettes?
And also, babeletse hore why re sa thomi hape ka di drugs? Tshwantse re thome from the stems. Mo horeng bana ba bantši ba thoma ka dikwai. Eo re ka se e hane ntho eo.
And someone indicated that why don't we first tackle the issue of drugs? We must start with this cigarette because these young kids, as they are growing, they start by smoking cigarette first before going to drugs and so forth.
Another thing, bar a khona le bitla la kwai, mara o renga batho ba hore ba kry-ile cancer from kwai.
And someone said, you cannot point out a grave and say the cause of death was cigarette. What do we say about people who are suffering from cancer as a result of cigarette?
Oh, yeah, I want to comment more this paper. So Hunalmo, it talks about the regulations and control of electronic nicotine delivery system and non-nicotine delivery system.
I wish to comment on this regulation. There's somewhere where it makes mention of the regulation and control of electronic nicotine delivery system and non-nicotine delivery systems.
How do you say hore the electronics, they are not dangerous when hore mo hore batho ba hore ba pregnant, they are not allowed, or abatshwanelo ba mo pela batho ba ba smoking if you say are they dangerous?
How can we say these electronic smoking devices are not dangerous, whereas it is said that people who are pregnant must not be in a close proximity from a person who is smoking or puffing these electronic smoking devices?
Bona batho ba batlang ka tsona ba advise bana ba bona hore ba sa di berekisa, so re reng ka tsona dilo tse bjang.
The people who are bringing these very electronic smoking devices are advising their own children not to use them. So what do we say about that?
Chair, what we want is to have control over these electronic devices. Hona le bana ba banyane ba hore ho ka ya bo phakeng, bana ba ina grade 7 ba bona le access to dilo tse so. So what we want is to regulate and have hore bana ba banyane ba sa bana le access to dilo tse so.
Chair, if you can go to the park, you'll find that very young children, children who are at the age of 7 are having access to these products. Hence, I'm saying this must be regulated. I thank you.
Thank you, Chair.
Yani bingelela, members of the parliament.
Greetings
And
to
our chairperson.
members and the chairperson.
Bingelela umphakathi as a whole.
I'm also greeting the community as a whole.
Igama lami ngingu-Kate Masombuka.
My name is Kate Masombuka.
Ngibuya e-Steve Tshwete municipality.
I'm coming from
I'm a
Steve
member
Tshwete
of the
municipality.
ANC.
I'm a member of the ANC.
Ngize lana ngizoyiphakamisa le bill ukuthi nami ngiyayamukela.
I came here to support the bill.
I-reason yami ukuthi ngize ngiyamukele,
My reasons to support the bill,
umamncane wami ubulawe yi-cancer.
my mother died
Buyomngcwaba last month.
as a result of cancer,
Ngenxa
and I
yokubhema
buried
ugwayi
her
kakhulu.
last month as a result of smoking too much.
Sinenkinga esibhekene nayo ye-youth.
We have a problem that we are facing with youth.
I-youth yethu mayiphuma esikolweni
Our youth, when after school,
babhema ugwayi emva kwama-tuck shop.
they smoke cigarette
Uthola
at the back
abantwana
of the
abanabo
tuck shops.
10 years,
You
11 years,
find
12 years,
kids
babhema
who are
ugwayi.
at the age of 10 or 11 smoking cigarette.
So i-cigarette ayisasiyinto esingathi yinto esingaphilisana nayo.
So
Ngoba
cigarette, it's something that we cannot live with now
ikhosa izinkinga
because it's
ku-youth
causing
yethu.
problems to our youth.
Bengicela ukubuza lana.
I have a question
Ngizophuma
here.
la kuThobako.
Ngizo-
Bengicela ukubuza ukuthi lana idaha wayini ngakayifakanga kule
I would like to ask,
yethu.
why have you not included Dacha in
Nesnafu
this bill?
isnafu wayini
Even
ngakasifakanga naso.
SNAFE, why is it also
Because
not
manje
included?
abantu abaningi
Because
bane problem yalezi
most
zinto
of the
lezi.
people have got
Sine
problem with
problem.
these two things.
Lena ngizoyiletha vele noma
I'll bring
ngingahambelana
this
tobacco.
up, even if you
Abantwana
can,
bethu
it's not
babhema
related to tobacco.
badla ama space cookies.
Our kids are eating
Izikolo,
space cookies.
ama high school sine problem
High school
eMhluzi.
level here in Mhluzi.
Sinama pin king, sinama
We've got
kingpin.
pin kings
Abeka ama space cookies.
who are baking
Then
space cookies,
bathengisa phakathi ezikolweni zethu
and they sell
bathengisela
those space
abantwana
cookies
bethu.
inside the
Because
schoolyards.
abantwana bethu baqale kuphi? Baqale ku cigarette.
Because our kids
Beza
started
kuphi?
smoking
Kudaha.
cigarettes and now
Manje
they
sine
went to
problem.
Daha. So we now have
Enkulu
a
manje
problem, a big
esihluphayo because
problem.
abantwana bethu manje abasa concentrate emaklasini.
Our kids are no longer concentrating now.
Abaningi bayagula, abaningi umthola
Most
umntwana
of them
ahlanza
are
athulula
sick,
ngenxa yalezi
they
zinto lezi.
vomit or have diarrhea because of these things.
Manje siyacela.
We humbly
Lebhili
request
iphasiseni.
that
Akube
this bill should
nomthetho
go through.
ozolwa nalezi nkinga lesi esibhekene nazo.
Let
Zinkulu
be
and siyasilimaza silimaza
Another
abantwana bethu. And
law
bengicela
or
uphendula
regulations
lo
that
bhuti
will
lona
face
othe,
other
umzali
challenges. Can I also
akafundise
answer the guy who
owakhe
said
umntwana.
the parent must teach
Okokuqala
his or
ngiyavuka
her
ekuseni
own child?
emsebenzini.
Firstly, I wake
Angimazi
up and
umntanami
go
ukuthi
to work.
wenzani.
I don't know what the child is doing at home.
Amagwayi usiwathola ema-toilet wesikolo.
We found
Afihliwe.
cigarettes inside the school's toilets.
So besicala ukuthi i-government ayikhe
So
isukume ibheke lezi
we
zinto
request
lezi.
that the
And
government
nale
to
ndaba yenyawupe.
stand
Hayi
against
ningasitsheli
this
ukuthi
thing
ningasitsheli
and the
ukuthi
nyawupe.
inyawupe anikho kiyo.
You must
Asana
not tell us
bafana,
that you
abantwana
don't
bethu
care about
bamantombazane bolobola
nyawupe.
bobani. Bolobola
There are
bobani.
no boys anymore. Who's going to marry
Hayi.
our kids?
Hayi. Siyacela.
We are
Sicela
humbly
nisizeni.
requesting, help us.
Niyekela ama-foreigners abusa i-country
You
yethu.
let foreigners rule
They
in this
take,
country.
maye take over.
Foreigners have taken over in this
Niphakamisa
country.
amabhili marabona
You now
nibasusa
talk
nini?
about these bills.
Kulezinto
When
lezi
are you going
abasenza
to deal
zona?
with these foreigners?
Asasimnandi.
It's no longer nice.
Nathi abantwana bethu sifuna abashade.
We also want
Manje
our kids to be
makangandoda
married.
boshada ubani?
So if there are
Niyathula
no
kuyo
men to
yonke
marry
lento eyenzeka in
them,
our
who's going to,
country.
what's going to happen?
Thank you.
Thank you very much.
Sanbanani,
Greetings.
bingelele abaphathi bethu bonke lengaphambili,
I want to-
umphakathi wonke.
Greet the honorable
Ozelana.
members.
Before, can I request that you also allow the interpreter to do the work because some of us, we can't hear Nguni language.
Okay.
I would like to greet the honorable members who are in front of us as well as the community in large.
Igama lami nginguSharon wakamathebe isibongo,
My name is Sharon Matebe.
i-ward committee ku-ward 19 ku-Steve Tshwete municipality.
I'm a ward committee in Ward 19 in Steve Tshwete municipality.
Ngaphambi kokuthi ngichubeke nokukhuluma ngendaba yebill, ngithanda ukusho ukuthi kubo bonke esikhona la ngaphakathi, umuntu uma emela ngaphambili ulethe umbono wakhe.
Before,
Akusiwo umbono wakho ukuthi uzovumelana nawo noma uphikisane nawo.
before I go further with my input, I want to talk to the members who are here, that everyone who has the opportunity to stand here is giving his own or her opinion. So it's not about whether you agree or disagree with that opinion, but he's here to share his or her input.
And bese ngicela ukuthi silalele.
And I ask that please, let's give that person a chance and give him and listen.
Everybody is entitled to his opinion.
Wonke umuntu unelungelo lokumeka umbono wakhe.
Ngithanda ukuthi ngisho ukuthi ngiyawuvuma lo mthetho mlingwa.
I would like to say I accept this bill.
Uma bakhuluma ngokuthi regulate, abakhulumi ngokuthi vele sebazosusa zonke lezi zinto. I don't think kukhona la kubhale ukuthi lemisebenzi la batshala khona uTobacco will be closed.
When they talk about regulate, They don't say we are going to ban everything. I'm not sure if in this bill is there any part that say they will close all the farmers.
Owami ke umbono enginawo lana ukuthi ngicela ukuthi before ni uphasisa ake sibuyeleni phansi sifundiseni umphakathi.
My opinion is that before this bill becomes a law, let's go back and try to teach the community.
Looking at clause number 16,
Uma ngibheka isigatshana number 16,
offenses and penalties.
esikhuluma ngamacala kanye nezijeziso.
Uma ngibhekile so ama penalties lawa are a bit harsh for umuntu ongawazi mhlawumbe ukuthi what is expected of him or her.
Uma ngibheka lezi zinhlawulo zibonakala kimi zinzima kakhulu uma zithathwa phela ukuthi umuntu akazi ukuthi yini ekulindeleke kuyena.
Uma uthi uyabhekisisa kahle lama penalties ngathi abhalwe out of anger ukuthi vele sifuna ukuthi asisusele lento.
If you look, these penalties, it seems as if they were written out of anger, as if we want to punish them.
So ke ngithanda ukuveza nje ukuthi ngiyavuma lo mthetho mlingwa net ake siyobheka lama penalties ngoba imagine nje ubaba wakho so sebafika ekhaya bathi bambophile bekabhema 6 months ejele.
I would like to express my feelings that yes, I accept the bill, but let's just let's just have a chance to look when it comes to penalties, because we won't be happy if you come back home and find that your father has been arrested and will spend 6 months in jail because he was smoking.
Sengiphetha ngithanda ukuveza ukuthi ake sibuyeleni siyobhekani ezincwadini zethu ukuthi what is meant with regulating. Akusi ukuthi seba beki stamp bathi ngci sesiyasusa zonke igwaya salifuna emashelvini akusafuneki ini kodwa kufuneka nje ukuthi abantu bazi ukuthi ugwayi uyabulala and kufanele ukuthi ba respect omunye umuntu ukuthi lo uzomlimaza lo angeke umlimaze.
In conclusion, I ask that please let's go back to our documents and try to see that when they talk about regulate or regulations, it's not that they say they will ban everything, there will be no cigarettes in the shelves now anymore. No, it's just to say, please respect those people who are not smoking, so in order to protect them.
Siyabonga ma.
Thank you.
Lochani,
Greetings.
Njani?
How are you?
Ngisifiso wakamtawung Sibongo.
My name is Fiso Mutaung.
Umthetho ngiyavumelana nawo. Ngiyafisa futhi ngelinye ilanga ukuthi ningaphinde
I
nibuye-
support the bill and I wish that you could again come back.
nibuye senizositshela ukuthi nizowususa at all emashelfini.
And I wish that when you come back, you should be coming here to tell us that you are now completely going to remove the cigarettes from the shelves.
Isikhalo esikhulu esingasebenzisa ukuze sikhona ukususa wonke ugwayi emashelfini asibuyeleni esikolweni sofundisana izingane ngogwayi ukuthi awukho right.
Now, the greatest weapon that we can use to ensure that we completely remove tobacco from the shelves is to go back to school and teach kids about the dangers of tobacco.
Ngiye ngawungena ugwayi mangina 13
While I was 13 years of age, I was smoking.
but ngenhlanhla ngo2006 eKwaGafontein kwaba ne campaign laba sifundisa khona ngogwayi.
But fortunately, In Kwaggafontein, in the year 2006, there was a campaign wherein we were being taught about tobacco.
Lapho bathi khona Gimoja, I'm fine without drugs.
The campaign's name was Kemoja, I'm fine without drugs.
Na certificate angasithola khona yiso leseng proud esingikhomba ukuthi ngiyabhini namhlanje.
Now, this is the certificate that I was given.
So engikushoyo isikhali esinaso asibuyeleni ebhodini siyeni phansi ebantwaneni abanabo primary sofundisana bona ugwaya ulungile bazonilalela abantwana bayalalela at early age abantwana bayalalela.
Now, the weapon that we have is for us to go back to school. Let's go down to the primary school and teach those young kids about the dangers of tobacco. Now, because they are still young, they will listen.
Mina ngilifunde kuna 13 ngenhlahla nangina 17 bengileka, but if ngakuthola lokho kunabo 7 mhlambe bengeke ngize ngilinge nokulinga. Ngiyabonga.
I started smoking while I was 13, but fortunately I managed to stop smoking. But if I had started while I was 17, I probably would not have stopped smoking. I thank you.
Thobela ka moka ba mo pele ga ka.
Greetings to everyone.
Ke raba ka mo pele.
I'm actually referring to the people who are in front of me, whereas they are not even answering or responding to my greetings.
To the ones at the back, hello. Thank you. My name is Lazarus Adimare Lesabane.
Ke nna Lazarus Adimale Lesabane.
I do not agree with the bill.
Ke kgahlanong le molao tekwa o.
Ke ka shame e kgolo gore re mo today. Ga ra tshwanela gore re be re kopane ka tsela e.
It is actually very shameful for us to converge in this manner. We were not supposed to meet in this way.
Molao ga se ona o gatelela economy ya batho ba bantsho.
This bill is actually aimed at oppressing or suppressing the economy of black people.
The leaders tja rena, what you are currently doing, you are putting firewood in a fireplace and expect it not to burn.
Baetapele ba rena, ka botse lena, le tšea dikgong la di kgotletša godimo ga mollo, mme la emela gore dikgong tšela le di beileng di se ke be di a tuka.
Nna ke le jwalo ka nna so, nka se dumele ke bona mosadi wa go rekiša ditamati le dieiye ka toropong a bisa ke maphodisa ka lebaka la pack of 20 ya kwae ye e le gore o e rekiša go direla bana ba gage dijo ba tlo tšea mosadi ola ba mo tshwara poo ba tlogela ditamati tšela kwa mosadi ola o stoka ditamati tšela ka eng.
I myself will not allow that a female person who is selling tomatoes in town be subjected to a form of abuse by the police officer for selling 20 cigarettes or a packet of 20 cigarettes, because eventually that particular lady will be robbed. Where will she get money to buy the basic needs for her family?
Tobacco can be concealed, very simple, it's a very small thing.
Mojoko o ka fihlega ga bonolo. E tloga e le ntho e nnyane mojoko.
So if it's a woman, they can conceal it everywhere and expect her to be searched and stripped on the streets because she is trying to make a living out of a mere tobacco.
Aga fihla mojoko mafelong a mantši a mmele wa gagwe.
Bontši
Ke
ba
mo
rena
e leng
more
gore ba
basadi
tlo
le
nyaka
basadi.
go mo searcha. Most of us here are female people.
Le a tseba gore metse e mentši e tshwere ke basadi ke bona ba ba rekisang metsoko mo seterateng.
We know that females are breadwinners in most families. They are the ones who are selling tomatoes in the street.
Ene rena re le bana ba South Africa re ka se dumele go bona batswadi ba rena ba sotlwa ka baka ke maphodisa ka baka la molao we ile gore ngwadile ke batho ba go tswa ka ntle ba ile gore rena ka melao ka dinageng tša bona re ka se kgone go dira melao.
And we, as South African children, will not allow to see our parents being victimized or subjected to abuse by police officers because of a bill which was written by people who are not South Africans. And mind you, we cannot go to a foreign country and make some regulation in that particular country.
Ge ke tswalela e re busetša morago apartheid ge le gopola botse ka apartheid batho ba rena ba sa dumele go rekiša jwala ba Sesotho be bo khutišiwa.
In conclusion, I would like to say it seems as if we are heading back to the apartheid era. If you can recall, our people were not allowed to sell African beer.
It was
If you
hidden,
are
Mama.
selling African beer, you were supposed to conceal it.
It was hidden and it was not allowed. So therefore,
Bo be bo
let
fihliwa bo
us
sa
not
dumellwa.
ban or put this bill to pass. It would not even been here. It is shameful what we are doing, guys. I
Jwalo,
close.
ke ruma ka gore, a re ska thekga molao, molao ga o ska tswella. Ke senya ke rialo.
Good day, everyone.
Nginibingelele lonke.
My name is Solomon Madisa Marule.
Igama lami uSolomon Madisa Marule.
I come from Eznamben Extension 14,
Ngibuya ezinambeni extension 14.
and I'm a member of ANC and also a businessman.
Ngilunga le ANC futhi ngisoma business.
I support the new bill
Ngisekela lo mthetho mlingwa lona
since it produces a new policy in dealing with tobacco and support the terms and conditions being made.
ngenxa yokuthi ke iveze imigomo emisha ene futhi ke ngisekela lokho.
We need control in tobacco and drugs.
Kwamele sikwazi ukulawula ugwayi nezidakamizwa.
And we need to stop the illegal, illicit trading of tobacco and
Futhi
drugs.
kwamele sivikele noma simise ukuthengiswa ukutholakala kugwayi ongekho emthethweni okanye nezidakamizwa.
We need to teach children at an early stage
Kwamele sifundise abantwana basesebancane
about tobacco and the dangers of tobacco
ngogwayi nokuthi ugwayi liyingozi kangakanani
and the consequences thereof.
nemiphumela kanjalo.
Tobacco prices should be high.
Igwayi kwamele lithengiswe ngemali ephezulu
So children won't be able to afford them.
ukuthi abantwana bangakwazi ukufinyelela ukulithenga.
And the level of nicotine and touch should be reduced.
Futhi nezinga le nicotine kwamele lehliswe la egwayini
So that it won't cause lung cancers and other diseases.
ukuthi ke ingakwazi ukwenza ukuthi abantu baphathwe icancer yamaphaphu.
And also street vendors should not be protected on this law.
Ene futhi nabantu abathengisa la emigwaqweni akumelanga bavikelwe kulo mthetho.
Because these illegal cigarettes, you mostly find them on the streets.
Ngenxa yokuthi logwayi okulingekho emthethweni kaningi litholakala la emgwaqweni.
Because they buy it less.
Ngenxa yokuthi balithola ngemali ephansi.
So I support the parliament in this.
Mina ngithi ngisekela iparlamente kuloku.
I thank you.
Ngiyabonga.
Sanibona malunga waseParliament.
Greetings to honorable members of parliament.
Mbingelele nemalunga womphakathi.
Also, greetings to members of the public.
Lo khulumako omengaphambili uSipho Mkhondo ubuya eVictor Khanye municipality.
My name is Sipho Mkhondo from Victor Khanye municipality.
Okungenze ukuthi ngize lapho ngaphambili
What made me to come here and make this submission
ile bill
regarding this bill?
lapha ku offense and penalties.
Lapho kukhulunywa khona ngokungazibandakanyi nomthetho kanye nokuhlawuliswa.
From 16.1 until 16.6.
Ukusuka lapha ku 16.1 kuya ku 16.6.
Bengicela emalunga waseParliament sekahlale phansi awubheke lo mthetho.
I would like the honorable members of parliament to review the referred section.
Because angeke ukuthi umntwana wakho aqale kuphula umthetho wena somshaya ngeliswati eliphezulu.
Because you cannot punish your child for a very simple mistake.
There is no warning sign there, they just in prison.
Akukho sexwayiso lapho uyaboshwa.
Yabo.
Thank you very much.
I'd like to greet the Portfolio Committee of Health
Ngithanda ukuthi ngibingelele ikomiti elihlonyiwe lezempilo
and the community.
kanye nomphakathi.
My name is Dr. Sharon Nyatsanza.
Mina igama lami Dr. Sharon Alexander
Nyatsanza.
Nyatsanza,
Yeah,
ngiyaxolisa ngalokho.
And I come from the National Council Against Smoking. National Council Against Smoking.
Mina ngibuya ku National Council Against Smoking.
And we support the bill in its entirety.
Siyawusekela lo mthetho osivivinya ngokuphelele.
South Africa has a growing population with more children who actually form the population.
Iningizimu Afrika ke abantu bakhona ke bayakhula ikakhulukazi izingane.
Tobacco industry does not target adults, it targets children.
Kanti lemboni yogwayi yona ke iheha kakhulu izingane ayiheyi abantu abadala.
And therefore there is even an urgent need for a country like South Africa to pass the bill.
Kanti ke kukhona isidingo esiphuthumayo kulizwe elifana neningizimu Afrika ukuthi libe nalomthetho ofana nalona.
Countries like companies like British America Tobacco or Philip Morris International, they export these cigarettes to the Western world.
Izinkampani ezifana ne-British American Tobacco nezinye bona ke basusa ke lolu gwayi kumazwe aphesheya bawulethe kule lizwe lethu.
Even their headquarters are in these countries where they have very strict tobacco control laws.
Kanti ke futhi ke undlunkulu wazo lezi nkampani zikulawo mazwe lapho kukhona imithetho enqala ngokulawulwa kogwayi.
In these same countries, they are starting to talk about what they call the tobacco end game, where they see a world with no tobacco.
Kanti kulawo mazwe sibaqalile ke bayakhulumisana ke ngendaba yokuphelisa ugwayi bafuna ukubona isizwe lapho kungekho kubhenywa noma kungekho gwayi kwanhlobo.
South Africa must pass this bill because the repercussions of a higher smoking burdens are even worse for developing countries.
Iningizimu Afrika ke kufanelekile ukuthi ke ibe nalomthetho sivivinyo noma lomthetho ngoba imiphumela yakhona ke yona akuyona imiphumela emihle ikakhulukazi kulizwe elisathuthuka njengeningizimu Afrika.
Countries like Uganda here in Africa, they did adopt similar laws and they've seen smoking rates reduced from 24% to 8%.
Amazwe ase-Afrika fana ne-Uganda babe nemithetho efana nalena kanti ke bona baye babona imiphumela ukuthi kube khona ukunciphisa kwalabo ababhemayo kusuka ku 24% kuya ku how many percent?
8%.
To 8%.
Since the 1950s, tobacco companies knew about the harms of tobacco and how addictive the products are.
Soloko go minyaka o-50s izinkampani ezikhiqiza ugwayi bezazi ngobungozi bogwayi nokuthi ke ugwayi ke luyingozi kangakanani emphakathini.
Instead, they hid this evidence and they lied to the public.
Kodwa ke bona bafihla lobu bufakazi baphinde baqambe amanga emphakathini.
In other countries, governments have started to sue the tobacco companies for lying and defrauding and to recover the cost of treating tobacco-linked diseases.
Kwamanye amazwe uhulumeni sowuqalile ukumangalela lezi ezinye izinkampani ngokuthi bona bagodle le miphumela engemihle yokusetshenziswa kogwayi kanye nokukhwabanisa.
In the US, they've recovered over $200 billion US, and Brazil, which is in the BRICS, has actually also started a case to recover healthcare costs linked to tobacco.
Emelika bona sebaqoqe imali engaphezulu ko 200 billion ngalezo zinyathelo kanti nase Brazil nakhona ke baqhubeka ngalolo hlelo.
In closing, South Africa must pass this bill.
Uma sengiphothula ke iningizimu Afrika kufanele ukuthi iwuphasise lo mthetho
And start considering recovering the healthcare costs that government is carrying. Currently, 42 billion is used each and every year in South Africa to treat healthcare costs.
Baphinde ke baqale ukubhekana nendaba yokuthi ke bayithola kanjani ke leyo mali ebayisebenzisile ukulapha ke labo bantu ababe bathola izifo ngendaba yogwayi ukuze ibuyele le mali ingene esikhwameni sikahulumeni.
Thank you.
Ngiyabonga kakhulu.
Greetings to you, Chair,
Ke dumedishe modulasetulo
and all members of Parliament,
le maloko ka moka a palamente
and to the beloved community that we stand in front.
mmogo le setšhaba se rategago.
Firstly, I would like to state that I support the bill.
Sa mathomo ke tla rata go tšweletša gore ke thekga molaokakanywa wo.
I believe that this bill is being introduced and to make sure or to ensure that we as a country, we are responsible.
Jwale ke kgolwa gore molaokakanywa wo o tšweletšwa go kgonthiša gore rena bjalo ka setšhaba re batho ba rwalago maikarabelo.
And being a responsible government, I am sure that this bill is not created to create unemployment.
Gomme bjalo ka mmušo wo e leng gore le ona o rwala maikarabelo ke na le bonnete bja gore molaokakanywa wo ga o tšweletšwe go kgonthišiša gore go ba le tlhokego ya mešomo.
But to create responsible citizens.
Eupša go hlola badudi ba rwalago maikarabelo.
Smoking is a health risk.
Go kgoga ke kotsi mo bophelong.
Yes, there are businesses that are surviving from it.
Ke nnete gona gore go na le dikgwebo tšeo e leng gore di tloga di kgona go tšwela pele di thuša ke gona go kgoga.
All we can ask them is accept us trying to be responsible with our own health.
Bjale seo re ka se kgopelang go bona ke gore ba amogele ge re leka go bana le maikarabelo godimo ga maphelo a rena.
It will be wise if our next step is to go back to the schools and teach our children the dangers of smoking.
Bjalo ge e tla be e le selo se bohlale ge re ka boela dikolong ra ya go ruta bana ba rena mabapi le dikotsi tša go kgoga.
My last request would be, let's just revisit the penalties.
Jwale kgopelo ya ka yona e tla ba gore a ke re boeleng re lebedišiše dikotlo tša ge motho a tshetše molao o beilwego mo molaokakanywa.
Because if you look at them, some people can take advantage of the laws.
Ka ge le gore ge o di lebedišiša o tla kgona go lemoga gore batho ba bang ba ka kgona gore mohlomongwe ba itirele boithatelo godimo ga melao.
So if we can just reduce some of them so that they are more reasonable.
Jwale go ka tloga go thuša ge re ka leka go fokotša tše dingwe tša dikotlo tše gore e be tšeo e leng gore di a amogelega.
Thank you.
Ke a leboga.
Oh, I did not introduce myself. Okay, my name is Mpoi Joseph Picheng,
Leina la ka ke Mpoi Joseph Piche,
ward member, Ward 9 here in Malahleni.
le loko la Ward 9 gona mo Malahleni.
Good afternoon.
Ke dumedisha.
My name is Dr. Eddie Edward Mahotlo.
Leina la ka ke Dr. Edward Mahotlo.
I do not support this bill,
Ga ke thekge molaokakanywa wo.
mainly because
Kudu ka mabaka a latelago.
this bill does not differentiate between electronic cigarettes versus smoking.
Between
Electronic cigarettes and cigarettes.
Kudu ka ge e le gore molaokakanywa o ga o fapanye gare ga metsoko e ya mohlagase mmogo le metsoko e ya setlwaedi.
I present to you this evidence.
Jwale ge ke tlišitše bohlatse bjo mo pele ga lena.
Now, that's evidence.
Can you take your evidence to that table?
I will.
Ke tla buiša. Ke bona bohlatse bo.
So that is showing a US adult population of smoking versus vaping. And as you can see, the two graphs converge. The more increase in vaping and promotion of vaping as a tool for intervention to decrease smoking rates. You can see there, it works. I'll show you another one.
Jwale ge bjo ke bohlatse bo e leng gore bo kgona go
This is
bontsha
Sweden.
mabapi le diphapano magare ga Sweden mmogo le metsoko e ya mohlagase goba yona vaping.
Sweden has adopted a regulatory framework where they differentiate the two products.
Jwale ge Sweden yona e amogetše molao o e leng gore o kgona go fapanya gare ga ditšweletšwa tše pedi.
New Zealand,
Ke New Zealand ye le bonago mo pele ga lena.
I'm not here to, try to convince you because I'm emotional about this. This is evidence. For some reason, this evidence did not make it into writing this bill.
Jwale ge ga ke mo go tla go leka gore mohlomongwe ke le fetole menagano. Eupša se ke bohlatse le gona se tloga se nkgoma maikutlo. Jwale ge New Zealand e tšweleditše melao eo e leng gore e kgona go tšweletša goba go bontšha phapano le gona bohlatse bjo ga bo a tsenyeletšwa ge go thalwa molaokakanywa wo.
This year, or late last year, there was a Cochrane review which included 78 publications, scientific publications,
Jwale
right?
ngwaga wa go feta go ya mafelong go ile gwa bana le kopano mo e leng gore go ile gwa tšweletšwa dingwalwa tšeo e leng gore ke tša science tšeo e leng gore di na le bohlatse.
And this Cochrane review did not make it into this bill as a reference.
Le gona dingwalwa tšeo e leng gore di na le bohlatse ge go dirwa molaokakanywa o ga di a tsenyeletšwa.
And it was basically saying, or conclusively saying, that in terms of e-cigarettes versus NRTs,
Jwale seo e leng gore e be e se bolela ke gore ge go e tla mo metšokong e ya mohlagase se ke NRT.
yeah, NRTs, nicotine replacement therapy.
NRT e ra gore ke kalafo yeo e leng gore e šomišwa legatong la nicotine.
E-cigarettes were twice as effective than NRTs in that study. This is a study reviewing 78 studies, right?
Jwale ge
This did not make it into this bill.
bohlatse bjo bo be bo bontšha gore metšoko e ya mohlagase e šoma bokaone go feta,
Last but not least, these are biomarkers. The
Gomme-
graphs that you see here is a comparison of biomarkers, so markers for disease. So it's clearly showing people that take e-cigarettes versus non-smokers, and you can clearly see the markers are the same.
Jwale ge, bohlatsi bjo le bonago mo, ke maswao, ao e leng gore a kgona go le bontšha seemo sa bao e leng gore ba fola metsoko e ya mohlagase, mmogo le bao ba sa foleng.
Thank
was-
you, Dr. Eddie. Your time is up.
I'll hand in my submission. Thank you.
Ke a leboga, ke tla iša submission ya ka ko tafoleng.
Okay. Thank you very much. Good afternoon to the members of the Portfolio Committee
Ngiyabonga
And-
kakhulu
and-
ngibingelela amalungu ahloniphekile wekomiti.
and everyone in the hall. My name is Mohau Mokhele.
Igama lami Muhau Mukhele ngiphinde ngibulise wonke amalungu omphakathi akhona phakathi kule hall.
I'm the worker in the tobacco industry and also a FAU leader at the plant level and a father of two.
Mina ngisebenza kule mboni futhi ngumholi weFAU futhi ngubaba wezingane ezimbili.
Yeah. I've consulted my mother and my wife and my kids. They said I must let you know that all of us as a family, we are saying no to the bill.
Mina ngiye ngaqhumana ke nonkosikazi wami umama nezingane zami bathe nginazise nje ukuthi sonke nje siwumndeni sithi cha siyawuchitha lo mthetho sivivinywa.
But there's also one thing that I want us to celebrate, which is the young people who were able to come and express their opinion about the bill in this very forum.
Kodwa kukhona okunye engithanda ukuthi sikubungaze ke ikakhulukazi intsha bakwazile ukuthi beze la bazenza izethulo zabo kulomhlangano.
They are demonstrating one thing to me, which is with education, they will be empowered to make proper decision, irrespective of the regulation.
Bangi kusho ukuthi into engiphawulile ukuthi ke ngemfundo bayokwazi nje ukuthi bathathe izinqumo ezifanele ngalokho ukukhulunywa ngakho.
Where I'm standing, I don't think any of the young people who are here in the hall, they are smokers. But I think because of the education and the fact that they were capacitated, they chose not to smoke, which means education can be better than the regulation that we are proposing now.
Mina ke ngiyacabanga ukuthi intsha ela mhlawumbe ayibhemi ngoba ke bona bazikhethele ukwenza lokho bazithathela leso sinqumo ukukhomba nje ukuthi ke ngemfundo ke ungakwazi nje ukuthi ke uthathe isinqumo obone ukuthi ke kufanelekile ukuthi ungasenza.
When we say no to the bill, we are actually saying yes to their education, because the tobacco industry, in fact, issues a lot of money and billions into the fiscus of the government to be able to subsidize their schooling through NSFAS, through Agrisita, etc.
Uma sithi siyawuchitha lo mthetho sivivinywa ke bona ke sithi siyabavuma ngoba ngemfundo bayitholile ngoba imboni le kaGwayi iyakwazi ke ukuthi ibaqhase ngemifundaze kufana nase kuNSFAS nakwezinye ke izinhlangano ukuthi bakwazi ukuthi bathole lezinga lemfundo
Yeah, ngoba bagqwele bala kule ndawo manje. They may not be aware that if some of them were able to make their way into this academic education tertiary level, our funds are exactly there. They are what they are because of the funds that also come from the tobacco industry.
Ngoba njengoba sebagcwele la kulendlu ke kufanele ukuthi bazi ukuthi ke njengoba bona bafukulwa ile mfundaze ngale mfundo bazi ukuthi ke le mboni yiyo ebabhekelelayo ukuze bathole lezinga lemfundo abayitholile abanayo njengaba.
Yeah, I also want to deal with the anomaly that before you go to Dakha, you need to start with tobacco. I have a 16-year-old boy. He has been
Nebo,
involved
can
in,
you make your submissions? You are left with 2 minutes.
yeah. I have a 2-year-old.
And don't address other speakers. Just address us and submit your input.
I hear you, Chair. I hear you, Chair. I hear you, Chair. I have a 16-year-old boy who got involved in Dakha, and he never smoked. He never smoked.
Ngithanda ukuthi ke ngikhulume ngalento engavamile ukukhulunywa ngayo ukuthi umuntu makaqala ukubhema uzoya uzogcina sekabhema insango. Nginengane eneminyaka e16 ubhema insango akaze ayibheme ugwayi.
He is my boy. He never smoked tobacco. He went straight to Daha. And
Ingane
I took
yami
him to rehab immediately.
ingane yami ke ubheme insango angabhemanga ugwayi mina ngamthatha ngamisa lapha e-rehab.
So let not your case represent our case. These cases are unique, and I'm expressing my case.
Ungathi ke lokho okukwehlakelele ucabanga ukuthi kuyenzeke nakomunye mina ngikhuluma ngesipilweni sami.
Yeah. Quickly, let's talk about the illicit trade. Mr. Chairperson, illicit trade is any pack of cigarette that is sold below 23 rand or so.
Masikhuluma ke ngogwayi lomgunyathi ke sikhuluma ke ngalamaphakethe athengiswa ngo-23 rand yebo.
Yeah, if we were to suspend this session for now and go into the township and check the spaza shop, we will realize that we are having a more serious problem when it comes to illicit, more than what we are gathered here for.
Uma ke singamisa lo mhlangano manje saya ke lapha elokishini sabheka iphaza shop sizobona ukuthi kugcwele lolu gwayi ke okuyiyo ke inkinga enkulu kunalokhu okusihlanganisela namuhla.
That is why we are crying to you and say, committee members, what is straining the tobacco industry now is the illicit trade. And since COVID, illicit trade was able to shoot to 100%. It has now subsided to around 70, 71. It's a fact, and you have done nothing to focus on that.
Inkinga ke ukuthi ke le gwayi lomgunyathi noma le mboni ogwayi lomgunyathi yiyo ecindezela le mboni enamathela kumthetho icishe soloko ngalesa sikhathi se COVID iye yakwazi ukuthi ikhuphuke kakhulu le mboni kanti nina anikhulumi lutho ngalokho.
So our plea to you is that let us focus on illicit trade and the rest will follow.
Mina isicelo sami ukuthi sigxile kakhulu kulolu gwayi lomgunyathi bese okunye kuzolandela.
I'm going to make a request.
Ngizenza isicelo.
Please, humbly so, let's not attack each other.
Ngiyacela nje ngokuzithoba ukuthi ke thina singahlaselani ngamagama.
I think everyone has a right to speak his mind or her mind.
Ngiyacabanga ukuthi wonke umuntu unelungelo lokuthi aveze umbono wakhe
About the bill.
ngalo mthetho sivivinywa.
So I'm going to take another round of hands,
Sizothatha ezinye izandla
which is my last round.
so kuzoba ke abantu bokugcina ke labo.
I'm taking this side. I've dealt with this side. Akukho maziphinda ne. I know you. I know all of you since we started the program. So, uthetile, angitukhulumile. You have already spoken, Akirabuti. So we must give other people a chance to speak. I'm going to start at the back. Hlala phansi. The lady there at the back, wena sis, followed by you, nawe. Ngicela nihlale phansi, let's behave like adults. Bese ngiza ngobhuti lapha unecap ogqoke umnqwazi. Bese ngiza ngawe baba lohlela ecaleni. Wena. Then bese ngiza ngani lapha emuva noyi2. Bese ngiza ngawe sisi lapha ya. Blessing is the gentleman at the back. And then the blue shirt. No, not you. And then put your cell phone. Thank you very much. You can start. Ngiyeza la phambili angithi ngiqalele emva ngizaso. Wena ngikubona
Okay. Greetings, Chair, and all present observed.
Ngiyakubingelela sihlalo ngibingelele na wonke amalungu akhona weParliament.
My name is Khomotso Kali, and I'm from the Africa Center for Tobacco Industry Monitoring and Policy Research at the University of Pretoria.
Igama lami uNkosazana uKali ngibuya kulomkhandlu lo ongisengushilo ukucwaningwa lapha eNyuvesi yasePitoli.
I support this bill fully.
Ngiyawusekela lo mthetho sivivinywa.
Chair, I believe this bill is important as it will protect lives of innocent South Africans.
Ngiyathamba ukuthi lo mthetho ubaluleke kakhulu ngoba uzovikela impilo zabantu baseNingizimu Afrika.
When I say innocent, I'm referring to non-smokers, children, pregnant women, and also smokers who are often trapped by these tobacco industries, which are often international companies selling these products to trap our people in this long cycle of addiction, mainly because they want to profit here.
Uma ngithi abamsuke ngikhuluma ngezingane ngikhuluma ngomama abakhulelwe ngikhuluma ngabantu abangabhemi ngoba ke ngendlela kungakhona ke kuyabonakala nje ukuthi kusobala ukuthi imboni yogwaye yiyo ke ebacindezelayo ngoba ke kukhona ke le mithelela engalungile.
She worked closely with the National Council Against National Crime, and smokers often report not able to afford their basic needs. They need to feed their nicotine addiction.
Sisebenza National Council Against Smoking, but kukhona ucingo lapho abantu bashayela ucingo abaningi labo bashaya lapho bayakhuluma ukubona abakwazi ukuthenga izinto ezibalulekile ngendaba yokuthi bathatha le mali bathenge ugwayi ngoba so bangena egazini.
Chair still does not seek to threaten people's jobs or the economy. It seeks to protect South African harmful products.
Lo mthetho sivinyo wona awubhekelele ukuthi uvule amathuba wemisebenzi la eAfrika kodwa ubhekelele ukuthi uvikele amuzi bobungozi bokusetshenziswa kwemikhiqizo yogwayi.
Studies have observed dermal, respiratory, neurological, and psychological problems associated with tobacco farmers through exposure of agrochemicals.
Ucwaningo liye labonisa ke imiphumela engemihle ukuthi ke ikakhulukazi kusikhumba kumaphaphu nezinye ikakhulukazi kulabo abasebenza ngokutshala ugwayi ngendaba yokuthi kukhona ubuthi obuthile obenza ukuthi ke kube naleyo miphumela engemihle.
For instance, pesticides used in tobacco farming contribute to adverse health outcomes that can lead to death.
Ikakhulukazi le mithi yokubulala izinambuzane esetshenziswa la labalimi abatshala ugwayi kungenze kubuyingozi kakhulu kubantu.
There is what we call green sickness, that is a consequence of nicotine dermal absorption due to skin exposure from tobacco leaves.
Kukhona ke lesifo bathi green
Green sickness.
Oh, green sickness. Lokho ke kubangwa yilo buthi ngikhulume ngabo ngoba ke uma sebungena la esikhunjeni buba naleyo miphumela engemihle.
The risk for this illness is created by certain working conditions, mostly with handling wet tobacco.
Kanti ke iningi yale miphumela kungenxa yesimo sokusebenza njengoba ke labo bantu abasebenza lapho kulawo maplazi abatshala ugwayi babamba ngezandla zabo lo ugwayi.
Therefore, farmers and tobacco workers fall victim of health risks, and this includes women, children, like I stated, and older people who all participate in tobacco production or live near the tobacco growing fields.
Kanti ke lokhu ke kuthinta kakhulu abalimi kanye nabomama nezingane njengoba ngishilo kakhulu bonke ke labo abasebenza kuleyo mboni yogwayi bayachaphazeleka.
To conclude, Chair, yes, unemployment is a serious issue in South Africa, but I believe that this bill will protect job unemployment because it encourages the development of alternative industries, which should be considered. Thank you, Chair.
Yebo kuyiqiniso khona sihlalo ukuthi ke kukhona imiphumela engemihle kodwa ke lo mthetho sivivinywa njengoba ubekiwe kusho ukuthi ukhuthaza ukuthi ke kube khona ezinye izimboni ukugqilwa kuzona ukuze kuvalwe lezo zikhali zokuthi kwakhiwe amathuba wemisebenzi.
Sanibonani ngithanda ukunibingelela nonke ngokukhulu kunihlonipha nokuyithoba.
Greetings to all members of the committee with all due respect.
Igama lami nguNondumiso Ncamu and I support the bill.
My name is Nondumiso Ncamu. I support the bill.
I work at the National Council Against Smoking as a quit line officer.
Mina quick line officer in National Council of Against Smoking.
Ngisiza abantu baba ukuthi bayeke ukubhema ugwayi.
I help people to stop smoking.
I hope this corrects the statements that allude to smokers being sidelined, not helped and not cared for.
Ngiyathemba ukuthi lokhu ke kuyabonisa nje ukuthi laba ababhemayo ukuthi ke singamani nje sibacwase singabalekeleli ukuthi bakwazi ukuthi bamise ukubhema.
And also just to highlight that there are programs and rehabilitation facilities that cater to cigarette smokers.
Ithi ngisho futhi ukuthi ke zikhona izinhlelo ezibhekelele labo ababhemayo abafuna ukuyeka ukubhema.
At the National Council Against Smoking, we receive a lot of calls and emails from the public complaining tirelessly about involuntary exposure to secondhand smoking in workplaces, casinos, restaurants, and homes.
Tina ke sithola labo ke abashaya ucingo kanye nakuma email ikakhulukazi bakhuluma ke ngobungozi bazithola bakubo ke ngendaba ya logwayi ikakhulukazi kulezo which part is it? Ikakhulukazi ke kuzindawo abasebenza kuzo ezifana nama-casino, ama-restaurant nasemakhaya bachaphazeleka ngendaba yalabo ababhemayo bona bangawusebenzisi ugwayi.
There has been a lot of talk about human rights during this process.
Kube khona noma kukhulunywa kakhulu ngamalungelo oluntu kulesi sithangami.
But I have heard little to nothing about the responsibility that goes hand in hand with it.
Kodwa ke angizwanga lutho ngokubhekelela imisebenzi ehambelana nalokhu.
We have the responsibility to not infringe on the rights of others.
Sinamalungelo ukuthi noma sinomsebenzi ke wokuthi singachaphaze noma singacindezeli amalungelo wabanye.
100% smoke-free places in public indoor areas will protect non-smokers for they did not consent to it.
Lezo zindawo lapho kungavunyelwe khona ngo100% ukubhema ngaphakathi noma ngaphandle zizovikela abantu abangabhemi kakhulu.
It will also protect their health and human rights to breathe clean air.
Futhi izovikela impilo yabo kanye nelungelo labo ngokomthetho sisekelo ukuthi baphefumule noma ukuthi ke kube bakwazi ukuthi ke bakhongele umoya ohlanzekile.
I plead that we pass this bill
mina ngiyacela ukuthi siuphasise lo mthetho sivivinywa
because smoking in ways that unreasonably affect non-smokers will not and should not be allowed. Thank you.
Ngoba ke ukubhema njengoba ke kuchaphazeleka abanye abangabhemi into okungafanele ukuthi sivumele. Ngiyabonga.
Ngibingelele uchair nekomiti lakhe laseParliament.
Greetings to Honorable Chair as well as honorable members of the committee.
Ngibingelele umphakathi okhona kule ndawo.
Also expressing greetings to members of the public.
Igama lami ngu Dr. Zamani Sibanyoni.
My name is Dr. Zamani Sibanyoni.
From Victor Kanye.
I am from Victor Kanye.
General Secretary of Men's Sector in Mpumalanga District.
General Secretary we Men's Sector kulesi sifunda saseMpumalanga.
I supported the bill.
Ngiyawusekela lo mthetho sivivinywa.
Futhi ngiyajabula because thina as the men's sector.
I'm happy because we as the men's sector
we had many campaigns around Victor Kanye and around Malahleni.
sibe nemikhankaso eminingi eVictor Kanye kanye naseMalahleni.
Ama awareness about this tobacco dangers.
Ngokucwashisa ngobungozi bogwayi.
Sisebenzisana neHoro organization ekhona la eMalahleni.
Working together with Horo, which is an organization here in Malahleni, eMalahleni.
Yes, so sibona ukuthi ke yes lo mthetho awuqhubeke just because most of the companies now kunama mushroom companies enza ama illegal cigarettes.
Our view is that this bill must be enacted because there are companies which are mushrooming, dealing in illicit cigarette.
So manje those things they are harmful to people's health.
Lezo zinto zinobungozi kakhulu kuzimpilo zabantu.
Sibuye ku issue yesnafe ngizwa abanye bakhala ngesnafe.
Coming back to the issue of snuff.
With the snafe now, so they had problems ngama fake products.
There is a problem about fake products.
Ukusetshenziswa kwesnafe mostly kusebenzisa abantu ma traditional people.
Snuff is mostly used for traditional use.
So in most cases sesithola sisebenza nakuma tavern amantombazana most mase baphuzile babhema isnafe
And in most cases we find that young girls are also smoking snuff, especially in taverns when they are drunk.
Yes, and esikhathini esiningi basebenzisa nasezintweni ezirong engeke ngizibaleke.
And they also use it on other things which I cannot mention here.
Ngiyabonga.
Thank you very much.
Order.
Good afternoon, Chair, and members of the committee.
Ke dumedisha modulasetulo ga mmogo le maloko a komiti.
My name is, I'm Khosi Letlape. I'm an ophthalmologist by training and a health activist by choice. And I am a harm reduction advocate. Khosi Letlape.
Ke nna Khosi Letlape. Ke motho o e leng gore ke serutegi, ke ithutetse bongaka.
I'll go straight through the chase because my time is running out.
Ke tla ya straight ka ge ke lebeletse gore nako
I'm a
ya
past chair
mpeta.
of the South African Medical Association
Ke
and
moruti
immediate past president of the Health Professions Council.
Ko Medical Profession Council of South Africa.
And I have a few concerns.
Go
One
na le
of
dilo tse e
them
leng gore ke di lebeletse. E nngwe ya tsona
is saying highly addictive and toxic substance, nicotine.
ke ye e bolelang ka taba ya gore ke kwai e leng gore e
The statement ya
addictive
gore
ka mantswe a mang
nicotine ya
e
tshwaetsa.
tsenella mo mading a motho.
Hey. Now, I have a problem as a medical professional because we've promoted NRT for the last 2-3 decades.
Nna ke na le bothata ka ge rena e le rena batho ba e leng gore
And that would
re be re
suggest that
promota NRT mo mengwageng e
we have
metledi.
knowingly misled the public to use an addictive and highly toxic substance.
Jalo, re be re gapiša maAfrika Borwa le Swiswi, re ba diriša gore ba šomiše selo se e leng gore se tsenelela mo mading se ba dira makgoba goba lekgoba.
But that recommendation was based on the recognition that people smoke for the nicotine and die from the tar. And
Jwalo.
nicotine, even though addictive, is not what causes the major diseases associated with tobacco use.
Jalo, go ile gwa bolela gore motho o goga kwae e leng gore e na le nicotine empa o bolaya ke tar.
It would be unhelpful to have a bill that is based on misinformation.
Jalo, e ka se re thuše ka selo go ba le molaokakanywa o e leng gore ga wa fella ka tshedimošo.
Now, you also have something in the bill that says, encourage existing users to quit.
Jalo, gona mo molaokakanyong go na le mo e leng gore go ngwadile gore go hlohleletšwe batho ba e leng gore ba a goga gore ba se ka tšwela pele ka go goga.
That is admirable, and that is what I advise as a medical doctor.
Ke ntho e leng gore nka e thabela le nna bjalo ka ngaka.
But that doesn't stop me from understanding that there's 1.1 to 1.3 billion smokers in the world, 12 million of whom are in South Africa.
Jalo, go na le batho ba e ka bang 1.1 go ya go 1.3 billion ba e leng gore ba a goga mo lefatsheng ebile 12 million ya bona ba mo Afrika Borwa.
Now, what we need to recognize is that people who smoke are human too.
Jalo, se swantseng re se lemoge ke gore batho ba e leng gore ba a goga le bona ke batho.
And when they cannot quit, they are not only entitled, but it is our ethical duty as medical practitioners to point them to less harmful alternatives.
Jalo, ga se gore batho ba itiriša gore ba palelwe ke go tlogela go goga empa rena bjalo ka ditsebi bjalo ka dingaka re swantse re ba eletše re ba botše gore go nna le tše dingwe tše e leng gore ba ka di berekiša tše e leng gore ga di napile di le kotsi.
A bill that does not make that differentiation
Molaokakanywa o e leng gore ga o dire phapano
is not only promoting misinformation,
ga o tlhatlhoše go se botše batho tshedimošo ka botlalo,
but it is promoting harm to those we know. If they stay on combustibles, 1 in 2 of them will be killed by the product.
jalo e no ba yona eo ya gore o feleletša le gore batho ge ba sa tsebe gore ge ba goga dilo tše e leng gore di a laitiwa mohlomongwe
As you conclude, Doc,
I will conclude on the social aspect, where I cannot support a bill that promotes criminalization, that doesn't take into account how we live.
jalo nka se thege molaokakanywa o e leng gore o
Can you imagine
hlahloša bosenyi.
a father in a
nagana.
house who smokes, now he can't smoke?
Ntate
What are they going to
o e
do?
leng gore o a goga.
Are we
Thank you
encouraged
very much.
to say,
Sa kgone
I am
ho
smoking,
goga na?
child, go outside whilst I smoke in my house?
Jalo ra gore ntate o swantse
If
re
you
swantse
live in
re
a
ngwana,
starter camp where the
ya ka
distances
ntle
are small,
ke šale ke goga.
it
Go
means
dula
smoking will be
mekhukhung.
prohibited in a squatter camp.
Mo e leng
Let
gore-
us be realistic. Let us consider that people who smoke are human. Let our hatred for the industry
Doc, thank
not
you very
produce
much.
indifference for people who smoke.
Act like a professional, Doc.
Jalo ba e leng gore ba dula mekhukhung ba goga le bona swantse gore ba naganele e se ka ba taba e la gore re no
You
hloile
can still submit,
kwa-
Doc. You can still submit to the table.
Ke a leboga modulasetulo le ba
Thank
lekgotla la gagwe.
you, Chairperson, as well as your colleagues.
Nna ke nna Thato wa ga Mmako, ke nna ola a thekgang molawana
Order,
theo-
please.
My name is Tato Mako. I am supporting the bill.
Chairperson, ke supporta bill ye entirely, and today ka baka la gore ke nagana gore batho ba ba boletšeng ba opile kgomo le naka ke tlo re go wena ka re nna ke tlo e lebella at the side of the economy ka baka la gore batho ba ga mmako ke borakgwebo potlana bao e le gore ba iswere ka dikgwebo le tše dingwe tša tšona tša ditekisi.
I wish to indicate that I fully support the bill. The people who have already spoken were very truthful in which they said, and I wish to indicate that I am from the Mago family, and our family depends on these subsistence businesses, and we also have taxi businesses.
I want to firstly say that I want to quote from Karl Marx when he says that accumulation of wealth at one pole is at the same time accumulation of misery, agony of toil, slavery, ignorance, brutality, mental degradation at the opposite pole.
Jalo, Karl Marx o ile a bolela, a re ge motho a kgoboketša lehumo yena a nnoši, go feleletša e le gore o šomiša batho ba bang, batho e feleletša e ba diepa mokoti tša gagwe, mola e le yena a nnoši a hwetšang lešokotšo.
Chairperson, protect me. I can hear the noise from the back and it's distracting.
Chairperson, ngicela ukuthi ungivikele. Ngiyezwa abantu bayarasa le, angisakwazi ukukhuluma ngokukhululeka.
Chairperson, also I would like to say that one of the good reasons why we must strengthen these regulations is because we have noticed with shame the misbehaviors of this industry.
Lebaka le leng la gore ke re tiše letsogo mo molao kakanyong o ke ka baka la gore re bone boitshwaritlhephi gona mo lefapeng le.
So in 2020 we have seen the industry misbehaving during temporary ban of tobacco products, understanding that they were given production powers and they were supplying other countries, at which we believe that we have seen them smuggling or rather bootlegging these products back to South Africa instead.
Ka nako ya kiletšo ka 2020 bona ba lefapha la di metsoko ba ile ba fiwa matla a go tšweletša metsoko empa ba iša dinaga tše e leng gore ke dinaga tša ka ntle, bona ka bo bona ba ile ba feleletša ba khukhuniša yona metsoko ye ba e buša gona mo Afrika Borwa.
So ge ke tswalela ke nyaka go bolela gore also this regulation of vape is important, because if vape is a medical product, then equally they must be regulated and registered under section 226 of Medicines and Related Substance Act of 1965, and must go through separate processes as much as it is proven to be harmful. Then if it is harmful, because we know it's harmful, then we consider it as what we call adverse drug reaction.
Jalo, ke rata go bolela ka yona vapor ye, ka ge e le karolo ya dikalafi e swantse gore e ngwadishwe go ya ka section 22C ya Medicines and Related Substances Act ya 1965.
Yeah, in closing,
In conclusion.
I would also like to say that we cannot at all time nurse feelings of business fruits who bring their puppets here. Thank you very much.
Jalo, ke rata go bolela gore ga re tlo hlwa re rapeleng.
I think I've made it clear that let's not attack each other.
Sengishizo ukuthi singahlaselani, ke shetse ke boletse gore
Let's
re ska
behave.
kodutlana. Ake re
Before
itshware
the
gabotse.
speaker, there were hands this side.
Bekhona izandla eziphakeme kule site leli ngaphambi kokuthi umnumzana akhulume.
I'm going to note those hands because I can see ukuthi kunezitulo ezikhoyo la.
Njengoba
Buti we t-shirt maroon. Abuti wa cap. Buti, wena wempe mhlophe. Sisi laphayana. How many chairs that are left? Is up. But when I lay a mover at the back, and then you'll be the last one. Then you valid again. The lady, you are the last one.
Ngibingelela usihlalo namalungu ekomiti kanye namalungu omphakathi.
Greetings to Honorable Chairperson, honorable members of the committee, as well as members of the public.
Igama lami uPhilile Makhunga ngisuka South African Medical Research Council.
My name is Pilile Makunga from South African Medical Research Council.
Ngifuna ukusho ukuthi ngiyawuseka lo mthetho sivivinyo ngokugcwele.
I completely support this bill.
Ngizokhuluma kafushane ngeplain packaging with pictorial health warnings.
I'm going to speak briefly about the packaging as well as the warnings.
Mawubheka amaphakethe kagwayi wamanje, izexwayiso zibhalwe ngesingisi futhi ngamagama angekho makhulu ngokwanele.
When we look at the packaging, the health warnings are written in English and in fine print as well.
Kungasiza ukuthi kube nezithombe ezikhombisa ubungozi bokubhema.
It will assist a great deal if we have pictures which depicts the dangers of smoking.
Kubhalwe ngolimi lwethu ukuze si-understand ngokangcono.
And also written in our indigenous languages so that we can understand better.
Futhi into mayishiwo ngolimi lwethu kuyahlala emqondweni and futhi siyizwa kahle.
Because if something is conveyed in our own languages, we easily understand that and it sticks to the mind.
Lokhu kuzosiza nalabo abangakaqali ukubhema.
That will also assist those who have not yet started smoking,
Intsha nabantwana
youth and children.
bazi ubungozi bokubhema ngaphambi kokuba baqale.
They will know the dangers of smoking before they start smoking.
Abantu abangakwazi ukufunda nabo bazosizakala.
Those who are, the people who are illiterate will also be able to be assisted.
Ukuthi babone ubungozi bokubhema.
So that they can be aware about the dangers of smoking.
Futhi lokhu kwenza ukuthi amaphakethe kasikilidi angahehi abantu abasha.
And that will make the packaging not to attract young people.
Nabantwana njengamanje inemibalabala.
And children as well as it is at this point in time because it is the packaging is colorful.
Futhi ucwaningo luyasho ukuthi amazwe anjenge India neCameroon amazwe asafufusa ayawusebenzisa lo mthetho futhi kubonakala usebenza.
Research has shown that developing countries
In
are
conclusion,
using such acts and it is effective.
Yingakho lo mthetho sivivinya kumele uphasiswe ukuze nezwe lethu lisizozizakala.
That is why this bill must be enacted so that the country can benefit.
Ngiyanxusa uhulumeni ukuthi uvikele abantu intsha kanye nabantwana abaholi bakusasa. Ngiyabonga.
I am making a humble request to the government to protect youth, children who are the leaders of tomorrow. Thank you very much.
Greetings, leadership. Greetings to Umphakathi as well. My name is Maschaba Buddha from Stiftsvete Local Municipality, a member of the LED Executive Committee, also a ward committee at Ward 19.
Can you raise your voice, Maschaba?
My name is Maschaba. I'm a member of the LED Executive Committee of Stiftsvete Local Municipality.
Mina igama lami uMasithaba ngiyilungu ke laphana ku Swiftchat municipality.
I would love to say to our leaders in front here, ukuthi we appreciate the regulations that you want to bring on board.
Ngithanda ukuthi ngisho kubaholi bethu ukuthi ke siyancoma kakhulu lemthetho yokulawula eniletha phambi kwethu.
However, my issue is you come, you have regulations, you sit down, you have regulations that are frustrating the locals, and then on the national platforms, you guys are not frustrated. We are
Mina-
frustrated.
Ukukhathazeka kwami ukuthi niletha lokhu la kudida abantu la ekuhlaleni kanti nina le phezulu le kubonakala ngathi akukho nje ukudideka.
On the national level, there are no, yes, they say there are laws, the systems or regulations for the nationals, but then they're not in, like, I don't know how to put it. They do not adhere to those regulations. They do as they please. They allow the borders to be open for the foreigners to come and do illegal stuff here.
Kodwa ke ezingeni likazwelonke yebo imithetho ikhona yokulawula kodwa ke kubonakala nje ukuthi akukho kunamothela kuleyo mithetho ngoba izinto ziyenzeka kodwa akukho imiphumela izinto eziphambene nomthetho kufana nalabo ke abanca imingcele yethu bangene la kule lizwe lethu bazoyenza izinto ezingekho semthethweni.
So I would really appreciate, let it not be an exercise of that you've done the consultation for you to be able to pass the bill, but let those that are on the national level also adhere to the regulations as well as the locals.
Kodwa ke engithanda nje ukuthi ngikusho nje ukuthi ke nibhekisise ke leyo ndaba ukuthi ke ningamane nje nithi niyenza le mithetho kodwa ke labo abaphezulu bona banganamatheli kumthetho besithanda nje ukuthi nabo baqinisekise ukuthi bawuthambela umthetho. Ngiyabonga kakhulu.
I just looked all. I'm just going to do this and I'm going to give it to you, then you can just directly translate from maybe.
No, English.
Yes, English. Good afternoon, Chair and Committee. Nice to see you guys, all freshed up after last night's game. Committee, my name is Tony Nodi, I'm from Limpopo. And I just want to say that I specifically want to speak about the electronic devices today. So my concern is tobacco products are already regulated, and instead of speaking to you, it should have actually been the Minister of Police with regards to enforcing the current regulations.
Bengicela ukutolika lokho akukhulumile uyagijima. Uthi imikhiqizo yegwayi yona ke sokukhona imithetho eyilawulayo. Manje ke kunanokuthi sikhulume ngalokhu kufanele ukuthi sibhekelele ukuthi ungqongqoshe wamaphoyisa kube uye ke okwazi ukuthi abhekelele noma ke aphoqelele ukubandaka noma ukuthambelwa ngokomthetho kwale mithetho elawulayo ekhona yale mikhiqizo gagwayi.
Right, first I want to say that tight regulations will not prevent people from using nicotine. Now, people who are addicted to nicotine will find ways to get it regardless of the law. And then also electronic devices actually offers the option between nicotine or non-nicotine, which will actually make it a little bit easier for them. There you go.
Ngithanda nje ukusho ukuthi ke labo bantu ke ukuthi basebenzisa lemkhiqizo ene-nicotine bona ke bazohlala besebenzisa kunganakiwe umthetho futhi nokuthi lemshini esetshenziswayo ke ukubhema lemikhiqizo kagwayi ukuthi noma kungaba khona imithetho enqala yokulawula lemikhiqizo lokho ke angeke kumise ukuthi abantu basebenzise lemikhiqizo na lemishini yokubhema.
I see we're touching on 2 minutes already, so I'm going to make this one very quick. So regulation will criminalize responsible adults. All right. Now, if And it could actually make it a crime for adults to vape even in their own homes. Now again, vaping itself does not really affect anybody else. There's no such studies that actually prove it. However, there are studies disproving it. So this would be an infringement on the individual's liberties, and regulation will not achieve its intended goals. And I state that due to the stated goal of regulation is to protect the public health. Now, however, there is no evidence that regulation will achieve this goal. In fact, some studies have actually shown that regulation can actually lead to increased use of tobacco. For example, a study by the National Bureau of Economic Research found that 10% increase on cigarette tax led to a 4% increase in youth smoking. Vaping is expected to have a greater impact.
Okukhona nje ukuthi noma singaba nayo lemithetho enqala mina angiboni ukuthi ke izonqanda abantu ukuthi basebenzise lemikhiqizo kagwayi. Ucwaningo oluyaliyenziwa liyakhomba nje ukuthi labo bantu ukuthi noma kungaba khona imithetho efana naleyo kodwa ke kuba khona ukukhuphuka kokusetshenziswa kogwayi kanti ucwaningo elenzwe i-National Bureau of Economic Research ithole ukuthi kube khona ukukhuphuka kwe-10% kuntela sigaret ugwayi kanti lokhu kwenze ukuthi noma kutholakala futhi ukuthi ke kuno 4% yokukhuphuka kwentsha ebhemayo esebenzisa nale vapor kanti ke ingakho ke kuthiwa ke lemithetho yona ayibi nomthelela wokuthi ke abantu noma bamise ukubhema ikakhulukazi ke udaba ke lokuthi ke kulawula abantu abadala abazikhethela ukubhema ikakhulukazi emakhaya wabo ukuthi babheme. Mina angiboni noma ke ukuya ngocwaningo imithetho ayibi nomthelela kulokho kuziphatha kwabantu.
Right, and then one of the last things is regulation will create a black market for vaping products, and if vaping products are made more expensive or difficult even for that matter to obtain, people will turn to the black market to get them.
Lokho ke kuzoyenza ukuthi lemikhiqizo ye vaping ukuthi ke kube khona abenza ke abayithengisa ngomgunyathi ngendaba yokuthi ke kuzabe kukhona lemithetho enqala elawulayo lokho kuzokhuthaza ukuthi abantu ke bayishushumbise yilokho ke engicabanga ukuthi kuzokwenzeka.
In your conclusion?
Right, so I just want to conclude here now. Just want to say that in conclusion, the regulation of electronic devices and vaping itself would have a number of negative impacts on the sector, people, and society as a whole. Regulation would stifle innovation, harm the vapor sector, and disproportionately harm low-income people, create a black market for vaping products, criminalize responsible adults, and not prevent people from using nicotine. Thank you.
Okugcina ke engakusho ukuthi uma ke sesibhekelela ukuthi le vaping lokukhulunywa ngayo ukuthi noma imithetho ikhona angiboni nje ukuthi lokho kuzoyenza ukuthi abantu baye kugwayi kodwa ke kuzokhuthaza ukuthi ke khona abathengisa lokho lokho ukuthi black market ukuthi bathengise ngokungekho semthethweni ingakho ke mina angiboni ukuthi ke kunomqondo ophusile ukuthi labo bantu abadala ababheme ngokuzikhethela ukuthi bonke bese bathathwa njengezigebengu ukuthi abazikhethela ukuthi bazenzele kona njengabantu abadala. You are welcome.
Nginibingelele mphakathi leadership ngaphambili.
To as to the leadership.
Malami uNjabulo wakwaMbele.
Name is Njabulo Mbele.
Ithi nje ngisukuma nokuseka umthetho.
I stand up here to support the bill.
Isizathu esenza ukuthi mhlambe ngibe umuntu osupportayo. Uma ubheka ulusha lanamhlanje olusema drugsini laqala ogwayini laselindlulela kuma drugs okusho ukuthi lo gwaya uyifoundation yokuthi abantu ba introduceke kuma drugs.
The reason for supporting this bill is that if we look at people who are using drugs, especially the young people, they started smoking tobacco and they transitioned to hardcore drugs, as it were.
Kanti nawo ngokupackage kwawo uyakuveza ukuthi uyinto engalunganga emzimbeni womuntu.
And also the packaging has got warnings that it is dangerous to our health, to human health.
Sesikuvezile ke lokho ngizocela futhi noma sinubhekile ngoba kunesimo esibhekane naso la. Unfortunately we are addressing this community kodwa kunabantu abangekho lana laba bathengisa la kule door ezincane. Uma ungathi uyabheka ngesikhathi seCovid kuthi uma kuvala ugwayi bekukhona ugwayi besuthole iPhaza shop ongekho regulated la Mzansi.
Now we are engaged in this public, but there is a section of the community which we are leaving out who are dealing in this illicit tobacco. Because if you can look back during the COVID lockdown when smoking was not allowed, but we used to buy these cigarettes, the illicit cigarettes in the townships, they were freely available.
And uma ngabe uthi senze wenza ucwaningo uma ubheka umthetho ngathi uthi mos ukuproduce ugwayi kunemali engango 22 rand if I'm not mistaken ekumele uyikhokhele ku government. So ayihlangani ke la ukuthi usuthola umuntu uthengisa ugwayi with less than 20 rand ngokwe business mode uyacheka kunento engekho kahle kusho ukuthi labantu bakhanda ugwayi ongekho emthethweni nani as ugovernment anwazi.
Because if you can look at this fact, because according to regulation, there is this amount of money, about 25 rand, which must be paid by those who are plowing tobacco. But now we find that there are people who are selling tobacco for less than 20 rand. So that shows that it's an anomaly. And it seems like you as leaders, you are not even aware of that.
Kanti futhi ubuningi bethu lamasibhekile sesingabantu abayinhloko yemizi. Uma ubheka the cost ya ugwayi nje wodwa it's very high and sigcine sisebenzisa imali eningi entweni engeke izi ubenefit umndeni uyisebenzisele wena uwedwa futhi ngeke izikuphilise.
Because if you can look at it, most of us here, we've got families, but we use that money to feed our addiction instead of using it for the benefit of the whole family.
So ngokusekela kwami ngicabanga ukuthi lokho kuzokhona ukuthi kusave igeneration eza emva kwethu ngoba ngokwazi kwami umlomo wawudalela ukuthi sidle sikhulume siphinde sijabulise noma thandana bethu hayi kushunqisa intuthu nje.
Because I believe that this bill is going to protect us as well as our children who are future leaders. That is why I'm supporting this bill. And because as far as I know, the mouth was created for us to eat and do other things which are very special, not smoking. Thank you very much.
All right. I would like to greet the parliament members that are present with us, as well as with our community members present, right?
Ngithanda ukubingelela amalungu eParliament aphambi kwethu, ngithanda ukubingelela umphakathi wonke na wonke umuntu okhona lapha endlini.
My name is Umduduzi Masango.
Igama lami uMduduzi Masango.
And I just want to start by saying, upon the hypothetical passing of this bill, we have one positive cause which will create, or rather definancialize the tobacco industry, right? But we have a greater effect that this bill will cause.
Ngaphandle nje kokwenza ihaba kulo yonke lento ngokuphathelene nalomthetho sivivinyo, kodwa kukhona okuhle okungathi uma kuxoxwa ngawo kubhekwe ukuthi yini inhloso yawo lomthetho sivivinyo.
Problems like majority of our young professionals which are employed in the mine sector, in engineering sectors, they use nicotine and tobacco as a coping mechanism to deal with stress, which is particularly the underlying issue that we have here.
Okokuqala nje uma sibheka intsha yethu efundile esebenza njengonjiniyela nalapho esebenza khona inosebenza omningi ebhekene nawo besiba nencindezi bese izithola ke seyisebenzisa ugwayi ngenxa yencindezi yasemsebenzini.
With having to use nicotine as well as tobacco, as a form of coping mechanism, they are rather running away from the fact that they would resort to using drugs like your heroin, your crystal meth, as well as your marijuana.
Ibalekela ke ngenxa yokuthi ke yona ikhetha ukusebenzisa lo sisidakamizo okuthiwa inicotine isuke ibalekela noma inqena ukuthi isebenzise izidakamizwa ezimbi kakhulu ezifana neheroin nelunye inhlobo zezidakamizwa besiphephela kwinicotine.
Upon having said that, I would like to reject this bill, but rather would say, you reject, you reject.
Ngakho lokho ke engifuna ukusho ukuthi ngenxa yalokho nginquma ukungawamukeli mina lo mthetho sivivinyo.
But would ask rather the members of the parliament to really focus upon communal services of supportive therapy that we can issue towards our community, because in most cases, children have access to tobacco, to nicotine through adults, meaning an adult today will sleep knowing that they have money for bread that they had received from a youngling that is in need of the nicotine as well as the tobacco that the adult is going to buy for them.
Ngithi asiqhamuke neindlela ke mina lapha emphakathini wethu zokwelapha intsha yethu ezingazisiza ukuze yelapheke. Ngokwesibonelo abantu abadala bathengisa ke ugwayi njengoba sisho into efana nenicotine ukuze bathole imali. Ngakho uthi umuntu omdala ehamba eyolala ebusuku esuke bonga ukuthi imali unayo kodwa leyo mali usuke ithole ngokudayisela ingane ugwayi.
Because we are aware that in all the packages and everything that comes from nicotine, it clearly states that tobacco is not good for your health. Yet our youngings, our youth still adheres to tobacco and everything only because they had received access from a person that is above the age of 18. So in order to rather focus the finances that will fund this bill on having supportive therapy to the youngins so that they know how to deal with stress, they know how to handle their anger instead of resorting to using nicotine as well as tobacco.
Siyazi ukuthi amaphakethe amaningi kagwayi uma eqhamuka asuke vele nezixwayiso ezisuke zibhalwe kuwona. Kodwa ke ngenxa yencindezi abantu abasuke benayo bazithola sebewusebenzisa kakhulu. Ngakho kungakuhle ukuba uhulumeni azame ukugxila kakhulu ekutheni iziphi indlela ezingasetshenziswa ukubhekana nalolu bhubhane lokuthengiswa kwagwayi einganeni ukuze zithole ukwelapheka.
And this will really help or rather improve the use of nicotine within our community, because with majority of us as a youth, we grew up watching, I want to say soapies like Soap Buddies, whereby we are made aware of the harmful nature of what drugs will cause once you adhere to the use of drugs. So therefore, in terms of us, instead of passing a bill rather that allows them to say, you're not allowed to buy tobacco or nicotine or anything electronic by the age of 18, let's rather focus on showing them that this is how you're supposed to deal with particular stress, this is how you deal with your anger so that it kills a further market later. Because if you restrict it to 18, you're just only bundling me up to say, when I'm 18, I want to know what it's like to smoke. So if we kill the need and the desire to smoke, then we have effectively killed the whole tobacco within our community.
Thank you very much. Your time is up.
Makusetshenziswe ke inhlelo ke manje izosiza lezi ingane ngokwesibonelo ngesikhathi sikhula kwakuba nezinhlelo kumabona kude ezivezayo njengo Soul Buddies ukuthi kuyingozi ngani ukusebenzisa ugwayi. Ngakho lezo inhlelo zisengasiza ke kwenza futhi ukuthi kunokuthi kuphasiswe lo mthetho akusuke manje indaba yeminyaka yokuthi uma usuneminyaka engu18 usungakwazi ukubhema ngoba kwenza ukuthi enye intsha ihluleke ukubhekana nolaka nezinye inkinga ilinde ukuthi uma sengineminyaka engu18 ngizokwazi ke manje ukukhululeka ngokomthetho ukusebenzisa ugwayi.
Good day, everyone.
Ngiyanibingelela nonke.
My name is Fiso Mtembu, and
Igama lami uSifiso Mthembu.
I'm a scientist by profession.
Ngingusosayensi ngokomsebenzi.
I'm against this bill in its current form because the proposed bill combines regulation and laws on cigarettes and electronic nicotine delivery systems.
Inyawo enqaba nami lo mthetho sivivinyo angiwamukeli ngenxa ukuthi uhlanganisa imithetho nemithetho nqubo ndawonye kugwayi ngokwawo kanye nasendleleni yokuhambisa ikakhulukazi kulogwayi osebenzisa imishini ye-electronic.
This should not be the approach. An important consideration when proposing regulation is that non-combustible alternatives are not cigarettes and should not be treated as such.
Ngicabanga ukuthi akufanele kwenziwe kanjalo bekungafanele kuxutshwe ngabhande linye konke kuboshwe kunalokho bekufanele kuqhamuke nendlela yokuhlukanisa lezi zinhlobo zikagwayi.
Cigarette smoke resulting from the process of combustion contains thousands of chemicals, many that are known to be linked to the development of smoking-related diseases.
Siyaziwa ukuthi ukubhema ngokwakho kuneyinhlobonhlobo eziningi zamakhemikhali akhona ogwayini agcina eseholele ngisho nasezifweni ezibi.
These harmful chemicals are the direct results of thermochemical processes of combustion, which are absent and greatly reduced in products that do not combust, like heat-not-burn products.
Ngakho kuyabonakala ukuthi lama chemicali asuke elapho ayingozi kubantu uma njengoba besuke bewasebenzisa kodwa futhi angahlukaniswa angabi ingozi uma esetshenziswa ezintweni ezingokhelwa ngomlilo.
Applying risk proportionate.
Asisazwa ispeaker. Sicela umsindo wehle kancane.
Okay. Applying risk proportionately allows for non-combustible products to be promoted to the 11 million smokers in our country. Furthermore, considering that over 60% of smokers have expressed interest in quitting smoking, there is real opportunity to take advantage of the fact-based communication to provide clarity around new products.
Manje sekuyithuba lokusiza njengoba kwaziwa ukuthi nesigidi ezingu-11 zabantu abawusebenzisayo kube bekhona futhi abanye abazimisele ngokuyeka. Ngakho uma kungaba nemfundo ingabasiza kakhulu ukuthi bakwazi ukugcina benqobile.
Okay, our government needs to introduce a separate category for electronic nicotine delivery systems, just like the FDA in the USA and the Ministry of Health in New Zealand. Let us learn from the countries that have reduced their smoke prevalences, like Sweden, Japan, and the UK.
Makufundwe kwamanye amazwe ukuthi bakuhlukanisa kanjani lokho uma kuziwa kule mshini yokusebenzisa ugwayi yokubhema njenge FDA yase United States amazwe akwazile ukunqoba ugwayi njenge New Zealand ukuthi uma bekuhlukanisa iziphi izifundo nohulumeni wethu angazithola kuwona.
Thank you.
Ngiyabonga.
Good afternoon, Slalo Committee.
Ngiyanibingelela to you, Chairman, as well as the committee.
Thank you for my 15 minutes.
Ngiyabonga ngemzuzu yami ngu-15.
Chair, I feel your pain. You stood up and you instructed us that people, when they take this podium, they should not be insulting.
Ngizwelana nawe sihlalo ngoba ukhulumile ukuthi uma umuntu ekhuluma lapha akufanele kube khona ukuhlambalaza.
But there is a speaker that continues to speak and he insults people. I hope you've taken note and when we are in Joburg, he's not going to speak.
Ngiyethemba ubonile ukuthi sikhona isikhulumi lapha besilokhu sifika lapha sikhuluma amagama angemahle ngakho ngithemba ukuthi uma sesifike eJohannesburg ngeke sikhulume.
Education is very important.
Imfundo ibaluleke kakhulu.
One of the speakers, I think it was third from where I was sitting.
Esinye isikhulumi cishe besingesesithathu kulapho bengihleli khona.
Oh, I'm against the bill. I always forget.
Angisho lokhu kungaze ngikhohlwe angihambisani mina nalomthetho sivivinyo.
So the speaker was for the bill.
Leso sikhulumi sona sasibesiusekela umthetho sivivinyo.
Now when we speak about education, the speaker was for the bill, but the points that he made, they made sense because he speaks about the issues that are affecting the men in the street.
Lesi sikhulumo esikhulumile bese usekela umthetho wesivivinyo futhi namaphuzu ebesiwaveza abenayo ingqondo ezwakala ngoba abekhulumela umuntu ohamba le ngaphandle emgwaqweni.
Hence I say education is important.
Yingakho ngithi imfundo ibalulekile.
Now, we need to separate fiction from facts because this is not Netflix.
Kufanele sifunde ukuhlukanisa inganekwane neqiniso ngoba lena kuyona iNetflix.
So, yeah, we speak over each other, and what we fail to realize is that we have a common enemy.
Sithi njengoba sikhuluma mhlawumbe izinto esigcina nathi sisodwa singaziqondi bese sikhohlwa ukuthi kodwa isitha esibhekene naso sisodwa.
Our current laws are adequate.
Imithetho esinayo njengamanje sinayo yanele.
But we've got players or organizations that do not respect the current laws.
Kodwa sinabantu lapha noma inhlangano ezingayihloniphi lemithetho.
In our honest opinion,
Uma nje ngikhuluma iqiniso ngokombono wethu,
do we think enacting this into law
ingabe sicabanga ukuthi ukuthatha lo mthetho sivivinyo siwenze ube umthetho?
these people that are not respecting the current law,
Laba bantu abangawuhloniphi lemithetho esinawo,
would they respect this new law?
bazoshintsha ke bese bewuhlonipha umthetho omusha.
We are creating a problem on top of a problem.
Sakha inkinga siyakhele phezukwenye.
In conclusion,
Sengiphethe.
I want to bring this analogy since it's a Sunday.
Nakho engifuna ukwethula kini njengoba namhlanje kuyisonto.
King Solomon was a wise man, as we are told.
Inkosi uSolomoni sizwa kuthiwa yayihlakaniphile.
These two women approaches King Solomon.
Abesifazana ababili baya enkosini uSolomoni.
They have one dead body, dead baby. One baby is dead and one is alive.
Babephethe insane ezimbili, olunye lufile, olunye liphila.
All of them are claiming the live baby is theirs.
Bobabili babethi ingane ephilayo yabo.
King Solomon instructs one of his servants to bring a sword
Wabe inkosi uSolomoni usibize enye inceku ukuthi ayilethe inkemba
to cut the living baby in half.
ukuze ahlukanise ingane ephilayo phakathi.
The baby, the mother, who's not the mother, celebrates this thing.
Umama okodwa bekungeyena umama walengane wajabula ngalokho.
And
Thank you very much.
the mother, you don't want to hear my story, Shay. We'll finish it outside.
Good afternoon to the chairperson of the committee as well as the committee at large, as well as everybody in attendance.
Ke dumedishe modulasetulo, committee, mmogo le bohle ba leng gona mo.
My name is Lesego Mateme and I'm from the South African Tobacco Free Youth Forum.
Leina la ka ke Lesego Mateme ke tswa ko South African Youth or Tobacco Free Youth Forum.
And I'm here to submit my support for the bill.
Gomme ke mo go tsweletša go thekga ga ka molaokakanywa.
Thank you, sir. The reason why I support the bill is because it aims to introduce measures that will advance the health of our community while protecting young people and pregnant women and vulnerable groups.
Jwale lebaka la gore ke thekge molaokakanywa o ke ka ge e le gore o tliša magato a go ka šireletša setšhaba sa rena mmogo le go ka kgonthiša gore bana ba šireletšega mmogo le bao e leng gore ba hloka boitšhireletšo.
One of the key regulations that I support is the banning of advertisement of tobacco products at point of sale.
Jwale ge ntlha e nngwe ya molaokakanywa wo yeo ke e thekgago ke go ka thibelwa ga go dirwa ga dikwalakwatšo mo mafelong a thekišo.
Thank you. This is because according to the Big Tobacco Tiny Target study that was conducted by the South African Tobacco Free Youth Forum,
Gomme se ke ka baka la gore se sengwe sa di nyakišo tšeo di ilego tša dirwa ke mokgatlo o wa rena.
it has been seen that the tobacco industry has intensified their marketing at points of sales that are found between 300 meters away from primary and secondary schools.
Ke gore go hwetšagetše goreng ba dithekišo tša metsoko ba matlafaditše dikwalakwatšo tša bona mo mafelong ao e leng gore ke a thekišo mmogo le mafelo a e leng gore a gaufi le dikolo.
This just goes to show that the main target is not adults but the young people.
Jwale ge se se tloga se bontšha gore batho bao e leng gore ba tloga ba nepile go ka ba rekišetša ga se batho ba bagolo eupša ke bana.
I support this bill again because of the regulation or the proposal of the regulation of e-cigarettes because they are the starting point of nicotine addiction among young people.
Ke thekga molaokakanywa wo ka ge e le gore o tliša molao o e leng gore kwa taolo godimo ga disekerete tše e leng gore ke tša mohlagase ka ge e le gore tšhomišo ya disekerete tša mohlagaso ke moo e leng gore batho ba thoma gona go kgoga go fihlela e le gore ba feleletša e ba makgoba a metsoko.
Although these products are marketed as harm reduction tools, we need to understand that any harm is still harm.
Jwale ge le ge e le gore di tšweletšwa jwalo ka tšeo e leng gore ga di na kotsi eupša re swantše re kwešiše gore kotsinyana e nngwe le e nngwe ke kotsi.
Also, South African research has showed that unlike in Sweden, e-cigarettes have not been effective as a cessation tool.
Jwale ge ke boe ke tšweletše gape gore dinyakišišo di tšweleditše gore tše e leng gore di hwetšagetše kua
In your
Sweden.
conclusion,
Nyakišo tšeo e leng gore di hwetšagetše kua Sweden
Has not been effective as a cessation tool.
ga di a šoma go ya le ka mokgwa o e leng gore go bolelwa ka gona.
This means that in conclusion, it's important that this bill is passed, not only to ensure that the rights of young people as well as people who do not smoke are prioritized, but to ensure that we do not center the rights and revenue of the tobacco industry as opposed to the health of people. Thank you.
Jwale ge lebaka le leng la gore ke thekge molaokakanywa o le go kgonthiša gore o tšwetšwa pele ke go kgonthiša gape goreng re se ke ra beela letseno pele eupša re lebelele gape le maphelo a bao e leng gore ba swanetše ba šireletšwe. Ke a leboga.
Okay. Greetings to you, Chair. Greetings to my learned friends. Greetings to the House at large.
Ke dumediše modulasetulo bašomi ka nna mmogo le bohle ba lego ka mo.
My name is Olorato Kwebu, chairperson at Groom Sister and also secretary at Soshanguve Youth Forum.
Leina la ka ke Olerato Kwebu modulasetulo wa Groom Sister mmogo le mongwaledi ko Soshanguve South Africa Tobacco Youth Forum.
Thank you. I was raised by my grandparents. We had a garden at home. I love and respect farmers. Even at Groom Sister, we have community gardens to help the less privileged with vegetables.
Gomme ge nna ke godišitšwe ke koko wa ka mme re na le serapana ka gae ke rata mmogo le go hlompha balemi Jwale, le gona ko mokgatlong wa Groom Sister, re na le dirapana tša setšhaba go ka thuša bao e leng gore ke bahloki ka ditšweletšwa tša rena.
At Groomer Sister, we advocate for human rights.
Gomme mo go Groom Sister, re batho bao e leng gore re hlohleletša kudu ditokelo tša batho.
Our goal is to minimize teenage pregnancy, substance abuse. It is to eradicate poverty, unemployment, and challenges of gender-based violence.
Gomme nepo ya rena ke go ka fokotša go ithwala ga baswa mmogo le go ka fokotša tšhomišo bošaedi ya nnotagi mmogo le go ka fediša lehuma le tlhokego ya mešomo mmogo le dihllohlo tšeo e leng gore ke tša bong ka digaruru.
We have cases where they come to our office ask for assistance. They ask us to help them with their kids, take them to rehab, and also educate them about the dangers of public cigarettes and other drugs.
Jwale nna ba na le kelo go tšwa go batho e leng gore ba kgopela thušo mabapi le bana ba bona le gore gape re ba rute ka kotsi tša dibabli mmogo le go fa mmogo le go ka kaonafatša bokamoso bja bona.
Groomer Sister has partnered with Tobacco Youth Forum to host workshops and dialogues in our local communities.
Groom Sister e šoma mmogo le Tobacco Youth Forum ka go ka swara dikopano thuto mmogo le dipoledišano mo metseng ya rena.
Furthermore, we start with primary schools and tertiary. We aim to educate, inform, and encourage our teenagers and youth not to play with smoke.
Godimo ga fao re thoma ka dikolo tša tlasana tša bomapimpana mmogo le tša maemo a godimo go ka ruta le go fa tshedimošo mabapi le go ruta baswa mabapi le tšhomišo bošaedi ya metšoko gore ba seke ba raloka ka metšoko.
We are saying no to drugs and yes to sports.
Gomme rena re re aowa go diritibatši gomme re dumelelana le dipapadi.
Make your conclusion.
Oh, okay. We want our young people to go back to playing indigenous games like bati and skipping.
Jwale ge re nyaka gore baswa ba rena ba boele morago ba raloke dipapadi tša setšo tša swana le diketo bati mmogo le tše tša go tshela thapo.
Any adult found selling cigarettes to the children underage must be given a fine, or failure to do that, they must be sentenced and go to jail.
Gomme motho o mogolo wa ka hwetšang
Thank you very much.
Your
time is up.
A lefišwe.
I support the bill.
O swanetše a lefišwe ge a palelwa ke go lefa kotlo yeo o swanetše a romelwe kgolegong gomme ke thekga molaokakanywa
Ngilotshise ngaphakathi ngilotshise inkhulu nenhlangano ngokuhlukana.
Greetings, and I would like to greet everybody who's here and different organizations that are represented here.
Ojame ngaphambili ngumdla sakhe wakandala ngivela eThembisile local municipality ngaphansi kweqhakaza National Disability ne-DPSA yabantu abakhubazekile.
Standing before you is Mdlasake, and I'm representing the organization that he has already mentioned.
Kokuthoma ngithome ngithi ngungangabazi ngokukhulu ngithi ngiyayisupport ibill.
Firstly, I would like to say that I support the bill.
Ngingaqhaza ngithome ngeBhayibhelini mawungaqalisisa uzimu usazi from ukusazi usesiswini sakamakho.
I can start explaining by quoting from the Bible that God knew us since we were still in our mother's womb.
Ngathanda uzimu bekafuna abonyana sibheme bekasenzela inchimela abonyana sithotse kokule intuthulo yephezulu.
If God wanted us to smoke, He would have made us to have chimneys in our heads so that the smoke can go up.
Kunje kunabantu abakhubazekileyo ngebanga legwayi.
As we are speaking, there are people who are disabled because of smoking.
And impilo zethu njengoba sikhubazekile zithi umuntu makakhubazekile impilo expensive khulu.
So if you are, you've got a disability, life is too expensive.
Kumanje abanye abantu ababone emehlweni ngebanga lobonya abonina bebabhema khathi bazithwele bona.
Other people, as we speak now, other people, they've got they can't see because their mothers were smoking when they were pregnant.
Ngivumelana khulu nebill leyo mongaqala amadokotela amanye ayabhema esibhedlela thola kuyabhenya kuba nentombi zegwayi muthe ivalwe lento.
I support this bill because if you can look in other hospitals, even the doctors are smoking.
Ngiphinde ngithina kuwo wonke umphakathi siyalimala ngendaba ukuthina ukukhula kwami mangikhulako sidle sikhule emakhaya ubaba uyabhema mawuthi ubaba uyakuthunyisela uyakhitheka kuthiwa hey umncane kukwami la.
I'm saying as the public we suffer because in our household you find that the father is smoking, and when you claim that you are coughing because of cigarette, you are told that you are young, shut up.
Ngokugcina ngithi njengoba sikhamba sivele endaweni ngokuhlukana kude isikhathi sesikhambile ba onkhulu zethu singasikhohlwa abonyana sisela amapilisi basinikeze okugonywako.
Lastly, as you will be aware that we are coming from different places, so as we are about to leave this place, please give us something to eat because some of us are taking some medications.
Ngithokoza.
Thank you very much.
Good afternoon,
Ngiyanilotshisa
and all protocol observed.
zonke inhlalo ngokwahlukana kwazo.
My name is Fenwell Shilwati.
Ibizo lami nguFezwal Sishwati.
Fenwell.
Fenwell.
Yes. Shilwati. I'm a member of the community
Ngililunga lomphakathi
and a citizen of South Africa.
nomhlali walapha eSouth Africa.
I reject the bill and its content.
Ngiyawuraga ke lo mthetho omlingwana lokhu okumumethweko ngaphakathi kwawo.
Based on the reason that I'm gonna mention below.
Ngiraga ngokwenzathu ke nanzi engizozibala la.
Allow me to digress a little bit and take you in the journey during 2019 when the cigarette
Ngibawa
was banned.
ningivumele ke ngiphambuke kancane ngiye eminyakeni waka 2019 ngalesa sikhathi igwayi lingakavunyelwa ukuthengiswa.
The aftermath of that decision
Okwenzakalako ke ngemva kwaleso siqundo
led into this economic sabotage of the South Africa.
kwadosela ekutheni ke umnotho uwe.
Our GDP, which is gross domestic product, declined.
iGDP yethu ke yehla ke ngaleso sikhathi.
And secondly, SARS lost almost 39 billion.
Ngokwesizathu leso ke iSARS yaluza ofana yathola ilahlekelo efikela ku 39 billion.
Which was due because if we remember for education purposes,
Okwenzeka ngebanga lokuthi ke na ungakhumbula ngokwenhleso zezefundo.
cigarette is taxed twice. We called what we call sin tax and value added tax.
Igwayi ke libhadeliswa umthelo kabili na ungakhumbula kuba nomthelo wesono nomthelo wobungako.
Which clearly shows that tobacco is the cream of the economy through sin tax.
Okutshengisako ke ukuthi ke igwayi liyicream yomnotho.
And
Ngebanga
secondly,
lokuthi ke le tax le ethathwako kilo.
and secondly, it shows that during that decision that was made,
Kwesibili ke ukutshengisa ukuthi ngesikhathi okwenziwa ngaso leso siqundo
post to that, the MPC,
ngaphambi kwalokho ke iMPC
which the governor is Lesisha Kanyako,
le ephethwe ngubaba uLisija Kganyago
they always increase the repo rate which affect the back pocket of ordinary citizen.
bahlala ke bakhuphula irepo rate okuthwenya khulu ke abahlali abajayelekileko nje phasi abaphasi emphakathini.
Hence, I'm saying to those who are not conversant with this economic dilemma, I'm available outside to teach you
Kungakho-ke ngitsho ukuthi-ke kilabo-ke abangakazijwayeli lezi zinto
How
zomnotho,
as the
ngikhona
economy runs.
ngaphandle ngizobafundisa ukuthi umnotho ukhamba njani.
so that maybe you might.
Mhlambe-ke ningachuguluka kilokho enikuchoko nofana embonweni yenu.
So in conclusion, I'm just gonna give you a quote.
Nangiphetha
The greatest tragedy in life is not death, but abortion of the future. I thank you.
ihlekelele ekulu-ke ekuphileni akusikho ukuhulula ikusasa nofana ingomuso.
Ka le dumedisa ka moka ga lona, nna lebitso la ka ke nna Chanel Mashilo from South Africa Tobacco Free Youth Forum.
Greetings to everyone. I am
Chanel.
Chanel Mashilo from South Africa Free
Youth Forum.
Youth Forum.
And I support the bill entirely.
Ke thekga molaokakanywa o ka botlalo.
The reason why I support the bill, tobacco farming has a wide range of negative effects on the environment.
Lebaka la gore ke thekge molaokakanywa o ke ka baka la gore tša temo ya kwae e ba le khuetšo ye mpe mo tikologong.
Tobacco farming requires large amounts of water. Curing tobacco leaves lead to the large-scale deforestation.
Se seng gape ke gore tša temo ya kwae di nyaka metsi a mantši kudu ka maatla ebile le matlakala a gona ke a magolo a feleletša e le gore a ba le khuetšo e mpe go tša mahlathi goba dithokgwa.
Globally, 600 million trees are cut down to make 6 trillion cigarettes every year.
Mo lefaseng ka bophara le bopepetla go ba le dihlare tše ka bang tše 600 million tše e leng gore di a remiwa goba di a ripiwa gore go diriwe disekerete tše di ka bang tše 6 trillion ka ngwaga.
The process of curing tobacco often depends on the burning of wood. This releases carbon dioxide into the atmosphere and thereby contribute to global climate change.
Jwalo tshepedišo e leng gore e ba gona ke yona e ya gore go feleletša e le gore go ripiwa tšona dihlare tše e leng gore mafelelong go tukišwa dikgong. Seo se dira gore go be le muši o e leng gore o tshwenyana le leratadima. Seemo sa leratadima se tšhentšha goba se fetoga e seng ka bosona eupša se fetošwa ke seemo se e leng gore se baka ke meiši.
So go batswadi ba rona ke kgopela gore le re supporteng go protecta generation ya rena e tlang ka go sala.
To our parents, I'm pleading with you to support us to protect the coming generation.
Instead, there is unemployment, especially here in Mpumalanga. Guys, potatoes are so expensive. Instead of farming tobacco, can you please try to farm at least potatoes?
There is unemployment in Mpumalanga instead of people having to farm in tobacco. Why can't they farm in potatoes? I thank you.
Thank you very much, community of Mpumalanga.
Mphakathi waseMalahleni.
I hope you have made your submission.
Ngiyathemba ukuthi sonke sizenzile izithulo zethu.
Now I'm going to call the Speaker of Council.
Njenganje ngizobiza umkhulumeli weCouncil.
from Emalahleni municipality,
wala emaspalatini wasemalahleni
Councillor Mduduzi Mswati Kankosi,
ukhansela Mduduzi Mswati kaNkosi.
Thank you very much, Honorable Whip of the Portfolio Committee.
Ngiyabonga nosibephe we portfolio committee kileboga kudu esifepisa portfolio committee.
Good afternoon to everyone. Babu Dlamini, this is your second home from Parliament, and I'm told that I've got about 3 doctors where I'm seated.
Ngilochisa no Babu Dlamini ngithanda ukusho ukuthi uBabu Dlamini la na ikhaya lakho lesibili masingabali le eParliament sengitshelwe ukuthi la ngijame khona nginabodokotela abawu3.
But other than that, in the interest of time, I must greet all of you.
Ngaphandle kwaloko sengibheka ukuthi isikhathi naso siyakhamba ngithanda ukunibingelela nonke.
And always know that we are public office bearers or reps because of you. You are our employers. We are your employees.
Thanda ukutsho ukuthi thina kahle kahle sisebenzela nina nimakhuwa wethu yini enasikhetha nasifake ema-ofisini.
With that said, Chapter 4 of the Municipal Systems Act 32 of 2000 promotes what is happening.
Njengoba sengishizo chapter 4 ye Municipal Act 32 igqugquzela lento engisanda kuyitsho,
which is public involvement or public participation with community engagement. And
ichoko ukuthi ke ithanda ukuthi umphakathi uphawula amazizo wawo, umphakathi udlale iqhaza emthethweni.
awuthi ngiyibeke ngesintu ukhulume ngeEnglish sizoba fast sizoyivala ngokusheshsha. Ngithanda ukuthi before iParliament yenza noma ngabe yini kumele iconsulte nathi. So we must understand ukuthi yini ibill or public participation on this bill.
I would like to tell you that before a parliament passes an act, it must engage with the public. The public must be in a position to understand what is a bill.
So where I'm seated, I can see portfolio committee that you are a parliament of the people of the Republic. But you were here in Mpumalanga. For people of Mpumalanga, you are still going maybe to other provinces.
La ngihlezi khona ngithanda ukusho ukuthi ni parliament yalana eningizimu Afrika nizelana ebantwini baseMpumalanga ngiyacabanga ukuthi nisazoqhubekela phambili niye kwezinye izifunda.
Where I'm seated as the chief custodian of community engagement, I know that you have consulted the other 2 districts from Mpumalanga. Today it's your last day in Mpumalanga, which is Nkangala district.
Njengoba ngihlezi lana noma ngime lana sengiyazi ukuthi nikhulumisene noma seniqhumane nabanye bezinye igodi eziwu2 namuhla ilanga lenu lokugcina lana eMalahleni.
Meaning that you have covered Mpumalanga.
Lokho kusho khona ukuthi senihambele eMpumalanga.
With that said, in all the speakers that have made contributions, I'll speak only to this of Nkangala district.
Njengoba sengishizo ngithanda ukusho ukuthi kubo bonke abantu abasebaphawulile amazizo wabo ngithanda ukuphawula ngokuphathene naloko okukhulunywa abantu bala eNkangala district,
which will be Tembisile, Dr. J.S. Moroka, Victor Kanye, Emalahleni, Steve Chwete, and Emakazeni. And in the 17 that have spoken, the will of the people must be done. 14 has accepted the bill, and as a municipality or the district, we are accepting the bill.
And ngikhuluma ngeThembisile municipality, Chris Hani municipality, Steve Chwete, Pixley ka Isaka.
No. Leave that one because you are putting Chris Han and Pixley. We are not, I've mentioned, just saying Nkangala district. And with that said, let the will of your good selves be done. And as we are clapping hands, even if I'm touching your corner, you must clap hands.
Njengoba ngitsho ke noma mhlawumbe ngikuthinte la ungathandi khona ke kwamele ungishayele izandla.
We really appreciate because you are academians, you have made valuable contributions to the bill because these people sitting here are not instructing or dictating on what must happen.
Nina
They've-
nifundiswa. Labantu abahleli lana hayi ukuthi bayanenzisa bayanitshela ukuthi nina kwamele nenzeni.
all these valuable contribution, they'll sit down and look at them before the bill is passed. They'll add your information.
Labantu bazohlala phansi babheke izithulo zenu ngaphambi kokuthi lo mthetho
And we like,
uphasiswe
that
bazobheka konke
draft
okusemthethweni.
copy to be sent to Nkangala district for all municipalities and the organization of Nkangala to know before it is passed in parliament.
Bese ke lo mbiko ophathelene nalomthetho omlingwa uzothumelwa eNkangala district ukuthi zonke igodi zazi ukuthi ke kuzohamba njani ngokuphathelene nalomthetho omlingwa.
With that said, we are not dismissing other NGOs from outside Nkangala or outside Mpumalanga. And in Mpumalanga or Nkangala, we do things how we do them. We don't want people who are visitors to tell us on how to do things.
Hayi ukuthi ngixeka laba abangabuyi la eMpumalanga noma babuya kwezinye igodi. Ngithanda ukusho ukuthi la eMpumalanga senza izinto ngendlela kumele kwenzeke ngakho la.
When we arrive in your provinces, we will do as how Lagos do.
Asifuna ukuthi abantu abavakashile lana bazositshela ukuthi senze
No country must tell Mpumalanga, Emalahleni and the 6th municipality on how we must pass the bill. America must pass their bill, we will pass our bill, and we will align ourselves to the international standards.
Akekho umuntu wangaphandle kumele asitshele ukuthi thina lana senze kwamele senze kanjani.
We
America
respect these
izoyenza
honorable
imithetho
members of
yabo.
parliament, and they are representing interest of the masses, not of only their political parties.
Hloniphani lamalunga weParliament ezelana ngoba babheke idingo zenu njengomphakathi.
With that said, as the municipality will take these, because we are the host, to the district mayor and tell him that all municipalities must enforce bylaws that are in line with the bill.
Thina ke sizothatha lo mbiko siwumikise ku district mayor ukuthi kwamele kube nemthethwana ehambelana nalomthetho omlingwa.
With that said, that's why you see the law enforcement in Emalahleni. We have started operation looking at even the illicit cigarette in the Indian and Paza shops. And if we find that they are not in compliance, we'll close them.
Njengoba nibona la ngaphandle khona ama law enforcement la eMalahleni sesiphume umkhankaso silwisana nogwayo ongekho emthethweni siyangena ezitolo zamandiya kanjalo.
And people who think these honorable members are taking their jobs, they must think otherwise. We are going to fourth industrial revolution. They are preparing us.
Labantu abacabanga ukuthi lamalunga lawa ahloniphekile azobathathela imisebenzi kwamele baqabangisise kahle ngenxa yokuthi ke nikhumbule ukuthi sesiyosebenza ngetechnology kulamalanga ezayo.
Instead of our brothers and sisters going to the farm to farm tobacco using pesticide chemicals, you'll find that they can do it through a drone, because this is the law that must be passed instead of touching it with their hands, because that will cause cancer. And October, it's a breast cancer month.
Kunokuthi abobhuti nabosisi bethu bahambe bayohlanyela ugwayi bawubambe ngezandla kuzoyenzeka ukuthi basebenzise ama drone i-drone ihlanyele lo gwayi lo ngenxa yokuthi ke bazophathwa i-cancer mabawuphatha ngezandla ngo-October i-breast cancer.
As I close, go back to parliament, there's nothing called parliament or national, which is a country. Government belongs to the people. Tell them that we have accepted the bill, and the proper budgeting and funding is needed. And all this tobacco or cigarette or vapes that come, that is important coming from other countries, must be taxed high. And anything that is manufactured in South Africa must be taxed less. And that tax money must be used to reduce load shedding. That's the lunchbox we are giving you as Mpumalanga. Thank you.
Nina base parliament kwamele nifikele nibatshele ukuthi thina la eMalahleni siwuvumile lo mthetho omlingwa futhi ke kwamele kubekwe imali ezolekelela ukuthi lo mthetho uphasiswe ngendlela efanele. Okunye ukuthi ke kwamele kube ne tax noma imali entela eningi ezochargewa labantu abaletha lama vapors la eSouth Africa. Kodwa ke ama vapors enzwe lana eMningizimu Afrika kwamele kukhokhelwe itax less for ona, futhi ke le mali leyo isetshenziswe ukuqeda i-load shedding yabo.
Thank you very much, Honorable Speaker, for your input.
Siyabonga kakhulu somlomo ohloniphekile ngesethulo sakho.
We have come to the end of our meeting,
Sifike emaphethelweni omhlangano wethu,
but I want to make these following announcements.
kodwa ngithanda ukuthi ngenze lezi zimemezelo ezilandelayo.
That you are live. You are on TV.
Ukuthi nibukhoma kumabonakude.
What was discussed today, it's live.
Ukuthi nazi ke ukuthi bonke konke lokho ke kusakazwa bukhoma kumabonakude.
I've just received some messages, WhatsApp, to say, yo, we saw you on the TV.
Ngisanda kuthola imilayezo la ku WhatsApp ukuthi hey sikubonile la kumabonakude.
But the other issue is that next week from the 28th and the 29th,
Okunye futhi ukuthi ngeviki elizayo ngomhla ka 28 no 29
we are going to Free State for public hearing.
sizabe simikisa lesi sithangami le eFree State.
We are going to start at Bloemfontein
Sizoqala eBloemfontein
and move to Kronstadt.
bese siya eKroonstad.
Those are the announcements that I want to make.
Yizo ke izimemezelo bengithanda ukuthi ngizenze.
But ke ngibulele kuni bahlali baseMpumalanga
Thank you very much to you residents of Mpumalanga
ukuthi nisimamele nisinyamezele.
about for being patient with us.
Sifike esiphelweni semeeting yethu.
We are now at the end of our meeting.
Singabuyela emakhaya ngokuthokoza.
We are now going back home.
The meeting is closed.
Lo mhlangano uvaliwe. Siyabonga.